Good morning.
Good morning.
Welcome to the Davidson County Board of Commissioners meeting for Thursday, March the 6th. We're glad to have you with us today. I want to call the meeting to order and to call on Mr. McClure to do our invocation and pledge.
Thank you. Father, we thank you for this day. We thank you for all the blessings that you give to us as a community, as a state, a nation, and most of all, as the board and the board members. We ask your blessing upon all the folks in our county. We also, Lord, ask the blessing on all of the people who venture to put their name in for an election. It is never an easy thing to come up short, but we would just pray, Lord, for those that won and for those that didn't, that you would give them peace in the decision and that you would help them to deal with whatever's in their heart. Most of all, Lord, we ask for your wisdom and your discernment as we look at the budget and the ever-important projects that we have and processes that we have that spend the county's money. Help us to do it frugally. Help us to do it as we would our own. We ask, Lord, that you just be with everyone who is speaking this morning, that you would give them discernment, that you would give them clarity of speech. And Lord, we ask that you would be with this board. It's a hard thing sometimes whenever you set up here, and it's a hard thing to decide you're going to spend money here, you're going to spend money there. But help us to be discernful in that. In Jesus' name, amen.
Amen.
Stand for the pledge. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Chair, one thing I did not put on your agenda was to excuse commissioners.
That's what I'm going to do. Fellow commissioners, I'd like to make a motion to excuse Commissioner Truill today.
Second that.
And Commissioner Shell is seconding that. He had a medical appointment today that could not be changed. And,
Madam Chair, I also have one. I just got one from Commissioner Crotts. He has an emergency doctor's appointment as well. He would like to be asked to be excused.
Okay. And
Commissioner Crotts in my second.
okay. Thank you very much. So,
We do this verbally.
yes. All in favor? Aye. Thank you. Fellow commissioners, take a look at the agenda. May I have a motion to adopt and second the agenda?
So moved. We got to do this on
Second.
We can do this on the clicker, Chef.
Second.
All of the votes are in. And that motion carries 5-0.
Items for a decision and information that are deliberation today. We're here for the budget workshop. I'll turn the floor over to Mr. Smith.
Thank you, Madam Chair. Before we get started with our side, we've got 3 guest speakers. I'm going to go ahead and have them come consecutive order so that we can move on to the rest of the county stuff. I'm going to have Reed Thornburg come up to the podium if he can. A month or so ago, you may recall, you got an email from Debbie asking you to take a look through some applications for what Cardinal Innovations needs to seat a community advisory council. So I'm going to let Reed give you any more details on that. What we're going to be asking you all for next Tuesday night is approval to seat this council with some of the applications that you have available with you. So I'll turn it over to Reed.
Good morning. Thank you for the opportunity to come speak to you today briefly about our new governance structure that includes community advisory councils. We'll have a community advisory council in each of our 20 counties that we manage as an organization for behavioral health care, Davidson being one of those as a part of the Triad region, which I'm the regional executive for community operations for the Triad. And so what you were presented with was some information about the governance structure. You were also presented with a number of applications, I believe somewhere around, I hate to even say the number 13, but I think around 13, I hope it's a lucky number, 13 applications or so that for you to review. The Community Advisory Council appointees will be voted on and approved by each board of county commissioners in our 20 counties. And those community advisory councils will feed into our regional health council, which will contribute to determining not only financial support, but community support for integrated healthcare efforts in all 20 counties. So just wanted to briefly mention that, and then also if you had any questions about any of the applications that you received, concerns, shout outs, anything that you wanted to reference, wanted to be here as well to answer any of those questions. So, thank you again.
And there's a list of the applications at each one of your places this morning. I made that list and put it out there this morning for you.
Reed, is this a board action motivated by the board, the full boards of the Cardinal Innovations?
So the Board of Directors
Yes.
decided to approve a new governance structure for Cardinal Innovations Healthcare. You know, we had our local boards at one time that I think Zach had been serving on
Mm-hmm.
when we dissolved those to segue into the regional health councils
Mm-hmm.
and the community advisory councils. And so the community advisory council, the intent of that is not to replace the local board, even though those have dissolved, is to have a more community integrated approach to making decisions about not only funding that comes from Cardinal to reinvest into community projects. That will be without the influence of any Cardinal review. That will be the community advisory councils determining what those needs are and feeding those needs to the regional health council for voting on those. And so your representative from Davidson County, Scott Craver,
Yeah.
on the regional health council, as well as the board of directors.
Okay, so they're fully aware of this new advisory council, correct?
They are. The Regional Health Council has already met, and so we've reviewed the charter for the Regional Health Council. Scott's well aware of the current structure and the process for the community advisory councils. Yes.
Thank you, Reed.
What is, on this advisory council, what is the professional background? What is this board made up from? Tell me
Sure.
what the bylaws say or the
So,
occupations would be.
So Commissioner Yates, historically, we've had a community operations group that has met quarterly in every county, and that community operations was made up of local business professionals, healthcare professionals, individuals, anyone in the community that was interested in addressing the behavioral health needs of residents in the county, in all 20 counties for Cardinal. That dissolved as well to consolidate into the Community Advisory Council, where the intent is to have community representatives both from the professional healthcare community as well as business community, family members, members receiving services themselves, and really an open opportunity for anyone who wanted to come and participate. Our goal was to have between 7 and 15 individuals who would be considered voting participants, which are the individuals that you're reviewing for approval within that 7 to 15 member charter. And then it doesn't exclude others from attending, but that would make up the voting.
So there's no board makeup of 2 healthcare professionals, 2 elected officials, 2...
We didn't want to exclude that possibility. Certainly, we don't want to saturate the Community Advisory Council with
Right, one
5
or the other.
individuals from Novant, or 4 individuals from the health department, or whatever, make up there. So we did want to spread it out and make it as diverse as possible. So,
Okay.
But again, the application process was open to the public, so we did not exclude anyone just because there may be a duplication of their employer or what area of interest that they serve in.
So my last question, maybe y'all know this answer, maybe I missed the meeting. How did we narrow it down from 13 and come up with this 11?
It can be 13.
Yeah, I know, but you said
Right.
we got 13 originally.
An application.
It was
Oh,
on
okay, so 11. Yeah, I
11.
had 13 initially, I think, was on my list. So, you can approve up to and including 11 individuals.
It's 7 to 11?
7 to 15
I mean,
is
7
the
to
voting,
15, I'm
yes.
sorry.
So, and we submitted the total number that we had received.
So where are these applications at? I hadn't seen them. Did you email them to
I
us?
emailed out, I think, February 5th. I can resend them if you
We'll
like.
resend them out, yeah, it's a
Yeah.
pretty thick stack, we just
Yeah.
listed the names for today.
Okay, I missed that, I guess.
Mr. Thornburg, will they continue to meet quarterly or more often?
They will, right now, I think the intent is, initially starting out maybe every other month.
Okay,
The Regional Health Council is quarterly. And so the Community Advisory Council, by meeting every other month, in the months that the Regional Health Council is not meeting, to be able to advise the Regional Health Council.
Applicants, yeah.
So you will have, individuals from the Community Advisory Council, the chair and the vice chair, attending and feeding into the Regional Health Council.
Okay.
Yes.
Reed, when you receive applications, who screens those applications and pushes forward for approval?
We sent Cardinal, posted the application, invitation online, and we accepted all the applications that came in, and we forwarded those directly to the boards of, the county managers in each of our counties and the boards of county commissioners. It was our intent not to intentionally screen in or screen out anyone, but to offer some feedback as best we knew it, for those individuals that we had interfaced with previously, or knew that their, either through their employer or through their own experience or work in the county, had areas of influence or expertise, in healthcare.
Reed, what's the process, when the community, board meets and they make a recommendation, then this then goes to who? The regional?
Goes to the Regional Health Council, yes.
And the regional passes it on to Cardinal?
The Board of Directors for Cardinal, yes.
I thought that, but I wasn't sure.
There are, during fiscal year 18-19, just to give a brief, reference to one of the major purposes for those groups in the restructuring, during fiscal year 18-19, we were able to reinvest community dollars, to various initiatives in all 20 counties. And our goal was not only to allow the Community Advisory Council, Regional Health Councils to determine where those monies go, not Cardinal determining that, but for those bodies to determine that, as well as any additional funding that may be available through grants or any monies from the organizations that are attending and participating, to look at the health assessment that your health department does, look at hospitals' assessments, look at all the health assessments regionally and per county to determine the priority healthcare needs, and to channel and funnel those dollars towards those healthcare needs in each community.
Where will these meetings be held?
Locally, I think that's to be determined. The Regional Health Council meets in Winston-Salem.
Any additional questions?
Good job.
Looking at probably April for the first meeting,
Okay.
somewhere around the end of, end of April, May, 1st of May, something like that.
Okay.
Just one other question. The material that the, community boards will be looking at, where does that material come from? Is that from issues that Cardinal has had come up and they want a, community board's opinion or decision? Or are they supposed to generate their own discussions?
Their own discussion.
That'll be a short
Each
meeting.
Community Advisory Council and Regional Health Council will have a chair and a vice chair, and they will, within themselves, the intent is those groups within themselves will address any issues that come up, as well as any, initiatives that need to take place in the community that require funding, or maybe not, maybe it just requires a letter of support or some type of effort within the community, to support those initiatives, so around healthcare.
I
Is
think you're,
someone-
excuse me, I'm
Is
sorry.
someone from Cardinal going to be at those community meetings?
So King Jones, I think, will be at as many Community Advisory Council meetings as possible, and I sit on the Regional Health Council.
Thank you.
And that region, just so you'll know, historically, again, Davidson County has been part of what we considered our southern region, our Piedmont region, which was, Stanley, Cabarrus, Union, Rowan, and Davidson. And because of the new governance structure, we looked at reorganizing geographically those counties to, as far as congruence, to make a better fit. And so now Davidson County has joined Forsyth, Stokes, Davie, and Rockingham. So that's the region that I manage.
You said these applicants here has had prior experience with Cardinal? Somewhere?
Not necessarily.
interaction?
They could have attended some community operations meetings or been involved, in feedback with those. It wasn't a requirement, on our part.
So my question is, I guess, is this something we would have put on our webpage? We did put it on our webpage?
No, we did not
We
put that on
will.
our webpage.
We can.
We can.
For applicants to, because I guess you said y'all sent out the invitation.
It was on our website, yes,
Right.
for applicants to apply.
Okay.
Where we're at now is actually approving these 11, asking you all to do that next Tuesday night to seat this council. That's where we are now, unless there's any other questions.
Well, like I say, my question is, why didn't we put it on our website to see if there was applicants that wanted to apply for it?
Well, I mean, I think this is a Cardinal Innovations initiative. I mean, that's,
Well, I see that it is, but
Yeah.
we're appointing these people,
I
so
understand.
then that makes it board
I think,
action.
is the application process over?
It will continue as long as there's room for additional members within the 7 to 15.
As long as, so it's a
We will
revolving
we will
door?
continue to consider any
Okay.
applications that come in. But as of now, our intent is for this pool of individuals you receive to be our initial, community advisory
Since
council.
there's 2 slots available technically, or more than that, 4 slots available, is that something that we could run as well? To see if there's any interest in
I can
it?
follow up with you, sure.
On
I
the
can get
commu-
with
the
King
community?
Jones and follow up.
Cause if it's revolving, there's gonna be people who eventually come off,
Right.
and there's slots
But
available.
like I said, if the
One
board
year term.
appoints these people, then it's the board, in my
Right.
opinion, it's the
Right.
board's initiative to.
Initially 1 year with the potential to stagger so that you don't lose everyone after the first year, of service, so.
And
that's
you
what
may
we've had
go
to
through
do.
this, and maybe there's some here that you decide that, you know, if we're picking these folks.
We have,
Well, I would like to say something. As a parent of a child that receives, you know, services, my issue was, you know, first of all, when the worker was talking about applications and needing parents to be advocates and driving that, the first thing was, well, conflict of interest, what is that? Well, the regional council makes the decisions. This is an advisory council that kind of pushes up ideas. So there's really no affirmative, we're just ideas from family members, ideas from community leaders. It's moved on and voted on the regional side. To be involved in something like this, my name is one of the 11 on the list, including Fred McClure. I called Commissioner Yates, talking to him about it once I heard about this, because I thought it was a tremendous idea. I'm appreciative of what y'all do in our community. As a parent of a disabled child, the stress that you go through and trying to find the certain areas of care and respite care nurses and people that can help out with your family, I think it's invaluable. Some people can be involved with it and have no clue what a family member has to deal with on a daily basis and the support structure that y'all offer. So I think having those family members on the board is really important. Whether it's me or somebody else, I think we need that, and I appreciate y'all reaching out to those.
We value, we value the voice of experience.
Mhm.
That's why I asked what the board would be
Yeah.
made up of,
Yeah.
because you wanna make sure you got the right mix of people.
That's right, that's
You know, to
right.
make it a productive.
And you'll have
board.
representatives from our community, Consumer and Family Advisory Councils, or CFACs, who serve as well. And they'll report each one of those, CFACs from each of the 5 Triad counties will serve on the Regional Health Council. So you'll have someone with lived experience,
Mhm.
or a family member or parent of someone with lived experience. So
And I do agree with Commissioner Yates. I feel like there needs to be a good diverse group, because you don't want all of them just coming from one area.
Advocate for just one
That's right.
area, so,
That's right.
you know, to make a good board, so do you wanna say something, Mr. McClure?
Reed, the board approves these 11 slots, or 15, up to 15, I think you said. What is your mechanism for removal? If a person is not the kind of person that you thought they were, and they're not working, the way that they should be working, what is your process for removing that person from the advisory board?
because that, service has been determined by the Board of County Commissioners, any concerns or recommendations would come back to the county for consideration.
But,
And their attendance record would play a part of that as well.
so if a
there is a
person
requirement
went
in
out and committed serious crimes, and you don't have a mechanism that would automatically bring that person up for suspension, how do you remove a person that's been approved by the county commissioners?
So that recommendation will come back to the county commissioners because of appointment.
And then it's gonna require another vote to remove that person.
That's correct.
or not.
I can speak about what should be, what could be. Our hope is that that individual would dismiss themselves voluntarily, without having to go through a formal process, but certainly we would advise your county manager, and bring it to his attention, who would in turn let you know.
You know, where I see the bigger issue with that is somebody missing consecutive meetings,
Mhm.
like 4 consecutive meetings, and it should be in your bylaws, because.
It is, it's in the charter. And what we've done in the past, Commissioner Yates, is we have, been very flexible depending on the reason for absenteeism. whether or not that's for medical reasons or whatever personal reasons, we've taken that into account and have given opportunities for individuals to, have valid reasons for not
I
attending.
mean, there are valid reasons, but after a point, if you can't be productive, then, you shouldn't be a
Right, I
part
think it
of
would
the
be very
advisory.
clear, a track record of someone who's just either avoiding, completing their service or for whatever reason no longer has an active interest in serving.
And I think that's a good point, because, you only have so many slots. And I've seen other boards, makeup of other boards, and people never go to a meeting, but they're holding that slot for somebody who could be a willing participant, and contributor. And that's the reason I was asking is, do we have a process? You don't have to tell me what it is, but do we have a process that could replace that person?
Well, and our goal, just like you as a board, is to have a majority of attendees there to be able to have a vote, on certain, items that require that. So that's the intent as well, is to make sure that you have a quorum necessarily for voting purposes.
So the advisory board would make the decision to move it forward to the county? Is that correct?
Yes, yes. So King, they would discuss it, advise it. King Jones, who's Community, Integrated Health and Wellness, Director, would bring that to the attention, or myself, either one. So, yeah.
That's great.
Thank you.
There was a meeting in Davidson County that has kind of a group, I don't recall the name of it, that meets, and they passed out, applications, not applications, but a website where you could go get the applications and fill them out and, get them back in. And then there was a couple of emails that were sent out, or at least I got them, that if you're still interested and you hadn't done this, you need to go ahead and get it done. When I served on the Cardinal board, there were specific, slots that you had to fill. Some with county commissioners, some with healthcare, professionals, some with, citizens like he was talking about. And while there's no designated slots, they're trying to get as varied a board as they can.
Sure, an array of individuals and experience, their own personal experience, family experience potentially, as well as healthcare experience. Again, our goal is towards addressing the whole health needs of individuals, not primarily behavioral health, not primarily physical health. So looking at the whole health of individuals that we're supporting through the new governance structure. So that's where we're going as a managed care organization.
Is it the wish of the board that we go ahead and leave this on for Tuesday night to appoint these folks?
I wanna look over the applications first, I haven't had time.
Okay.
So,
So
I
maybe
don't know what
the
the rest of y'all, maybe you'll have
last
time to
meeting
look
in the
over them.
month or the first meeting in
I
April?
need to review them.
Yeah, I'd like to review
I need to
them.
review them.
So maybe the first meeting in April? Okay.
Now, we,
I'll get that email back out to you that has all the applications and all the
That-
information on it.
Does that get you in on your
I mean, I know
time?
y'all.
does that,
It may delay things a bit, but again,
With the second meeting in March, Ms. Yates, would that give you enough time if we did the second meeting in
I
March?
think it would.
Enough time. And like I say, I'd like to see it put on our website, I don't know if we can do that or not, but I'd like to open it up, I didn't, I wanna make sure our citizens.
I'll get with Joel, I'm confident we can
about
get it on.
that, and yes, can talk with King and follow up with.
Yeah, let me know, yeah.
And we may not get any applicants, but at least we put it out there for them to have a chance to serve,
Cause we'll need Reed's application, if you've got a form or something they can fill out, we'll need to
Yeah,
patch it into
electronic
ours
version,
somehow.
yes.
But we can get together with your folks and Joel and find out.
Well, and if we could
Easiest
put
way
like a
to do it.
little kind of, sort
Or a
of,
link to his,
a link to his
a link to his
website
site
on
and,
our website, plus we could also maybe put a little kind of press release together and put it out on the Sunshine List that we were looking for
That
applications.
will put onus
I
on
like
us for
it.
the legwork in terms of the software and the information, but, just if I could have just a quick moment, I wanna give a shout out to Joel and his team. Recently there was an ask from another county for, the opportunity to come into an agreement with sharing the information about the Community Resource app that's currently located on the Health Department's website here in Davidson County. That was a joint venture between the community college, the students there, and Barriers to Access to Care, which I serve on, Jonathan serves on. And just through that, reach out an opportunity to partner with another county who's also wanting to have those resources available, to them. And so your IT department has graciously agreed to work with that, county who's wanting first responders to have the same opportunity for resources
That's awesome.
and information for their county. So just a quick shout out to Joel and his team.
We're gonna put this on the website. I think whenever you put it on there, it's not just to submit your name. It's, you know, you have to complete an application and state your expertise that they're looking for on that board.
And I don't guess y'all asking for expertise from what I understand. Y'all's application is not asking for expertise. It's just if you're not asking for a doctor's background or a physician or healthcare or, am I right? I mean, that's.
Well, historically, and what Commissioner McClure had referenced was the community operations, community partners meeting that where individuals attended, and the primary attendees at those meetings were from health-related care organizations, as well as, business partners in the community who supported the healthcare needs of citizens in the county. And so the majority, just through the interest of healthcare, the majority are gonna be very likely those individuals who represent in some way, fashion, healthcare within the local community.
'Cause we
But
have
we're not
our own
excluding.
applications, correct? When people apply for our boards or we have our own application on the website.
Yes, sir, we do.
And
So, I mean, I don't understand why they just don't fill that out when you look at their.
the application process for Cardinal was very,
Hang on here, do what?
This board's not on that application. There is an other section on there. I guess folks could fill that out.
You know, because when we have applicants for other boards that we put them on, we look at their professional services or whatever.
We do,
Um,
and that is out there for folks to fill out. And I could revamp that application to add this board if,
To mirror the format potentially.
and Joel could update it on the
I would
website
think.
for us.
Right. I mean, I'm not trying to be difficult,
Oh, no,
but
no.
I serve on some boards, there's a lot of people, or there's some people that don't hardly participate at all, and that's not healthy for the board.
No.
And Cardinal's been through some issues before, you know that, so, some of the history with Cardinal. How many counties do y'all, service now, 12?
20.
20, okay. How's that working on the state level? Is that, I know at one time the state was kinda trying to get away from, maybe just trying to make one or two providers in the state, or is that, this has been a couple of years ago.
But last I heard, when I heard, was somewhere around 4 was, I think, their goal at one time was to look at 4 managed care organizations for behavioral health. So, I haven't heard lately if that's changed. I assumed it has not. I know with Medicaid transformation, with standard and tailored plans and also especially carve-out plan for foster care, the standard plan, has been stalled. And so, I think until a point in time when the tailored plan is decided to go live, which will be, driven and operated by your managed care organizations, like Cardinal in the state, not your commercial plans, they'll be operating the standard plan for Medicaid. It's still open for discussion by the state.
So that plan, and it's been a while since I heard any news on this, so I don't know if that's simmered down in Raleigh or not. Has it?
No.
For the.
There's not a go live date currently.
One of the things that we could do as a board, if we wanna get somebody from the state department to come down and give us an update on where the state is with the health insurance, because it's been postponed, 2 or 3 times now, and they don't really know what's gonna happen whenever it goes into effect, because he's talking about a tailored plan and a standard plan. And the insurance companies or whoever, the health department, whoever does the diagnosis, are gonna decide which one of them plans are gonna go in. But it would be a good thing, if y'all are interested, to have somebody from them come up and just explain where everything is.
And we have a document.
It's been a while since I heard any news on
If somebody
this.
from you,
We have a document that we can share as well that
Okay.
offers some additional insight.
very good.
So, yeah.
can I speak now, Mr. Chairman?
Yes.
To talk about the application procedure, I went through it. It's very, very, very specific. Are you a parent? Are you medical? The questions are laid out specifically for what y'all are looking for. And then when I reviewed the applications of the individuals that y'all had sent out before, of those that were filled out, there's a very diverse group of individuals from all over. So I think, and reading through those applications, some very, very good individuals. If we could get 4 more of that caliber, I think it'd be great. But, looking through the applications that was sent out, if y'all go back on the email, you can see the specific questions for the different, I guess, for the medical side, for the parent side, and the questions that they asked them, and it was really in detail.
Okay.
That's all I have.
Thank you, sir.
I'll update that application and we'll get with Reed.
We can,
Yeah, please do. I'm sure you got
Yeah.
some good applicants.
I'll follow up.
Like I said, I'd like
Yeah,
to see.
follow, sure.
And then I'll get those, the applications that we sent out earlier, I'll get all those to you this afternoon.
I mean, I know Fred knows it upside and down the other, so I don't have.
Better than
Not
me.
quite that much.
You know
I
it
don't
more than
know
any
any.
of us.
I don't know that the Secretary of Health in the state of North Carolina knows all of that. I think
Well, I
they're
can-
still feeling their way around.
Well, I can tell you that it's not putting us on hold in terms of moving our organization forward to be prepared for Taylor Plan operation, so.
So how many managed healthcare organizations are there now in the state?
You have, 6, I believe now?
Six.
6 or 7, yeah.
So the plan is, the legislators, I guess, are looking at 4?
That was originally the plan, and that's changed.
I don't know if it's been written in stone.
Right, how many, but they was gonna narrow it down to.
Yes, the consolidation.
Right.
Yes. Was on the table, so for
Right.
discussion, yeah.
Thank you.
Thanks, Reed.
Thank you.
Thank you.
Yeah, you're welcome. Thank you.
All right, Madam Chair, we'll shoot for the second meeting in March to move some of those forward. Ms. Yates, you see anything, you got issues on those applications, let us know. I'll get with Joel and we'll try to work those through on our side. I'm gonna let Scott Ryan from, Park come up. Scott come by and talk to, at that time, Mr. Chairman, Don Truhl, and we talked, I think it was last fall, was it this winter? I can't even remember, my days are running together.
2 months ago, yes, sir.
About some changes in park routes, with bus routes here in the county, so I thought it'd be good to have Scott come by and give you an update.
Good morning.
Good
I'm
morning.
Scott Ryan. I'm the Executive Director with Piedmont Authority for Regional Transportation. I wanted to come, as Mr. Smith had mentioned, we have talked with the county and working with Davidson County Transportation about our services, our park service, which is region within the Triad, Davidson County member agency of PART, and Commissioner Truhl sits on our board. We have a few things that we are going through with regards to all of our services, meaning that we have looked at many of our routes. I'm not here to seek money, if that means anything for the conversation.
That's a good thing.
Yes, it is.
I think you'll have,
First time, right?
Yes.
First time, no money?
no money, yes, unless you wanna talk about that, but I think I'll leave that up to you. I have quite a few slides, and I'm gonna go through, because I know you have a very busy schedule, so I don't wanna flip through these too quick, so if there is something that you have any questions, please let me know. I wanted to share with you what we have, in place now with regards to our transportation service, what we have been doing over the years, as, Davidson County, again, being a member agency, so this, I'm not gonna go back through all the history, but we have quite a few things that we've looked at with regards to our service and how we need to become a little bit more efficient. We're actually, for our program, we're talking about mobility. So we're talking about providing mobility and public transportation for your citizens and how we make connections across our region. So there's a few things that we are looking at in terms of some of our challenges and some of the things that we look into as far as our data, resources that are available of how we restructure some of our services to try to get the best ridership and the best use of your citizens. So I'll go through these. I want to make sure I hit the right clicker here. Very good. Very quickly, this is just a snapshot of our service that we've had. Specifically, going back, we've actually had 2 routes in Davidson County. You can see where it goes back into 2008, and we spiked up into 2010, 2011. Now, this was right in the time frame that going back to that point. This is where we were dealing with our national recession, so we had a great deal of change with regards to our citizens in terms of how they deal with mobility, how they get around. We also had 2 different routes. Some of those things that I won't go into great detail unless you want me to. Some of this is also dealing with frequency of service. We recognize that frequency of service has an expense element, but also has an opportunity element for folks to have different trips because there's more service that's provided throughout the day. So you'll see how ridership has been up, how ridership has been down, how ridership in 2019 has actually showed a little bit more increase, which is a positive thing. This next slide essentially is the same thing, but it basically just recognizes or shows how we have our service throughout our entire agency that really has different spikes, different peaks and valleys based on the season. So for instance, you can see Davidson County Community College students, when they're in session, that obviously means there's opportunity for more ridership. So those are some items that we recognize in terms of our service and the coverage that we have. This is very quickly with regards to what we've had for our routes and our services. You can see some historical. 2019, again, we had some increase in ridership, which was a positive thing. Our annual funds, the funding that we have is a You Drive It vehicle. Rental car fee, so there's a 5% rental car fee. That's how much that we collect annually, and essentially that's 26% of what our total budget expense is for our services here in Davidson County. This is the snapshots. I'm sorry that didn't come all the way clear for you, but this is essentially what we have in terms of our route, which is what we recognize here as Route 9. So this is our route in Davidson County. Here in Lexington, stops in Thomasville, goes into High Point and the High Point terminal, and then folks can have their transfer or their opportunity to expand into our network because we have services that go into High Point as well as Winston-Salem, Greensboro, and throughout the entire Piedmont Triad with our routes. This snapshot here is really representative of what we are trying to achieve with regards to our overall network. When I speak of our network, it's basically dealing with how we are connecting our communities, how we are connecting and utilizing the services that are in place with our local providers. And so this would include Davidson County Transportation, which I know that there could be some conversations later about what you're dealing with here locally with your routes that have been very successful, but also you have businesses that are coming in. We are looking at some other opportunities for some routes. Our connectivity, again, is not to deal with specifically the inner service that you have within your communities here in Davidson County or Winston-Salem, High Point. Those systems in place, we are essentially making those connections, going a little bit further and connecting those communities. And this, again, is really just what we're trying to achieve more with our services of how we have these multiple connections. Again, this gets into funding, this gets into timing, but we're not here to talk about all those things today. I did something wrong on that. Very good. This is, I wanted to share this with you. This is something that is reflective of our entire region. And it's more so, I would say this is more reflective of the Piedmont Triad than what we deal with in other parts of our state. We have a lot of commuting that occurs in the Piedmont Triad, and that is nothing new, essentially, but we have folks that are coming and going throughout our entire region for their daily trips, whether it's work, whether it's medical, whether it's recreational. This here in Davidson County, this is something that you may have seen, but this is part of the challenge that we deal with in terms of how we get more folks to utilize public transportation as a mode of their daily transportation service, how they actually get around. You can see on this particular chart, which is very staggering, but it's not the only thing that occurs here in Davidson County. The actual cost of citizens that we have here in Davidson County, our transportation and housing cost for your family income essentially is at 56%. That's a pretty staggering number, but when you sit back and think about it, yes, this is nothing that's really new or too unheard of. And again, that goes back to, I wanted to go back to this next slide. I'm not sure if nope. That goes back to this piece here with regards to all the commuting that we have and what those housing and transportation costs really represent for our citizens. This piece I wanted to share, this gets into a little bit more of what we look at when we talk about our service. What are we trying to get to? How are we trying to entice those folks that have mobility options as well as those individuals that need to utilize public transportation because they have no other mobility options? We have some lifestyle issues. We have commuter issues as well as those issues that really get down to your choice riders versus your transit dependent. And of course, reflective of that, making that available, that's what we try to do with our services and make that available for all people to get to their mobility and take care of some of the needs that they have. We have some individual items. These get in a little bit more into what is essentially what is those pieces that drive people to make decisions. How do they get around utilizing public transportation? Some of the challenges that we have is that we compete, our program itself, we compete with the automobile. How are we actually going to be in competition or do better than the automobile? And many of those things come down to cost, comes down to convenience, and how often we can provide service where individuals that have an automobile say, this is not a bad thing. What can we do? They can get out of your car because riding the bus is actually a benefit, but that comes down to an individual decision. And those ridership influences, those behaviors, those are some of the things that we try to put in place to where it's not a barrier, but actually a benefit for folks to look at. These elements here, this is what we deal with in terms of our daily service, because we have many of our folks that are traveling multiple jurisdictions, how we make those connections with our city systems, that's reflective here in Davidson County, but also our cities in Winston-Salem, High Point, Greensboro, and even our service that we have that goes from Greensboro down to Chapel Hill. How does that actually work for the individual? How does that connection come in place? How do we tie in our service with the local service, so people that are actually needing to get from one point to another and ride multiple services are not waiting for hours and hours to make that connection? So these are all elements that we go into when we look at our services and our service design, and how that's actually going to be something beneficial for folks to consider. Again, this is what we are looking for us and our agency, of how we make those connections work, how we utilize all of our resources to be efficient. And this is what we essentially have as of today within our region. Again, down on the bottom left-hand side is in blue is what Davidson County Transportation has, which has been very successful over the years with regards to expansion of service and ridership. We have some voids with our overall corridor services, but these are things that we continue to work on. For instance, we do not have a connection in place that's going into High Point down to Archdale, going down into Asheboro on 311, but that's a corridor that's out there that we'd like to look at more. We also have service opportunities that go up into Rockingham County. But these are all things that go into planning of what we can do, what we can accomplish, how are we efficient with those services that we provide. What are we trying to do, and what are we trying to develop? Again, we're looking at making those connections that are seamless, looking at how those opportunities can be made available. Again, you have your services here in Davidson County and what we're doing with regards to our overall network. Here is just a snapshot of some of the data that we deal with, what we look at, what you have in Davidson County. Again, I don't think it's anything shocking that you have a lot of folks that are going out of the county for jobs or for medical. You have people that are coming into the county. You have new businesses that are coming up. That's actually going to be a bigger draw for citizens within the county as well as throughout the region. And that's economic development. And how can we basically deal with, how do we complement any of those opportunities? And these are all the numbers that we deal with of where people are going from, where do they work, what is the public service that we can provide that actually is complementary to how mobility is dealt with on a daily basis. This is again, just a snapshot of what we have now. This is exactly what we're proposing to move into for the upcoming fiscal year. The biggest change, and I'll go back to this real quick, the biggest change obviously is with our service that we represent, or what we reference as Route 9, is feeding into Lexington, into Thomasville, and into High Point. What we are proposing into the upcoming year is that our service is going to originate or come into Thomasville. That's actually going to be timed up a little bit more with your Davidson County service. A lot of this also is that biggest change between Lexington and Thomasville is the service that you have now in Davidson County has been expanded to where you have connections in Thomasville and Lexington feeding into the Davidson County Community College. What we've seen over the past year and a half, 2 years, is that we have duplicative service. And so that is actually just not from an efficiency standpoint. There's no benefit for folks to pick between Davidson County and Park. Another element that goes into that is Davidson County has free transportation. Kudos to all of you for doing those things. Our service still has a fare. So again, this is an element that we're looking at in terms of how are we being efficient. We still have our connection and our service that comes into Thomasville, actually matches up with those routes that are provided by Davidson County. But if we go back and look at this other slide, the one piece that we feel that we are missing is those connections that are going to Thomasville and then into Greensboro and vice versa. That's the item that we're looking at in terms of this new service, is that we still have our connections, but we're actually expanding our route from Davidson County into Greensboro, because our travel and trips that we see where people are actually working has more connections, not just into High Point, but from High Point into Greensboro for some job opportunities. So that's the basis of what we're proposing to make a change, is that we're essentially going to change our routing, which again goes into frequency of service, how often we have that service, and how is that actually going to be more efficient than what we have now.
What is the fare, Scott? You may have mentioned that, but what is the fare?
Yes, sir. Our regional fare that we have is $2.50. Now that is we have different fare structures. So we have a monthly fare We have a 10 ride fare. Of course, all this is related to ADA, so a 250 is gonna be $1.25 for a senior citizen, a student, disabled, and a veteran. So there's fare structures. We also have, this past year, we implemented a new fare media collection. What that basically means is that we, for people that pay their fare, we still accept cash, but we actually have a mobile faring collection system, that we've put into our system where basically folks can utilize, these electronic, dreadful devices that we all live by. And you do those things online, and the reason I bring that up is when we implemented that new fare structure with a mobile fare payment, utilizing either a smart card or your smartphone, we've also implemented where we have a fare capping, service. And what that basically means on fare capping is we have many of our riders that can't afford a monthly pass. Utilizing the mobile faring system where you basically go online, set up your own account, which is nothing more than basically your name and a contact information, email or telephone. But that fare capping element is you're not gonna spend more for that month, for what your monthly fare would be. So instead of saying that you have to have a monthly pass up front, utilize the system, and you're essentially, what it basically means is you're gonna go 17 days if you ride the bus every day and not pay any more past that 17 because you've already reached the equivalency of a monthly pass. So those new elements that we put in place, we've been promoting that for folks to take advantage of that because there are some incentives and benefits for many of those things. We also have put in place a number of businesses that are getting discounts. And so we have University of Chapel Hill. We have a number of businesses that are an extension of our Business 40 closure. We had a great deal of involvement with Business 40 closure and certain mitigation. But we have different structures and different benefits for employers that actually pass down to employees with reduced fares and just getting more participation.
You could offer that to the county as well, right?
Yes, sir. Absolutely.
Might be something we'd need to look into.
Well, and that, and with this and other pieces, I would say, and we shared with Casey and work with Guy and Richard and many other folks here is with your businesses, you've got a big, new employer. We all know who that new employer is coming in and drumming up different opportunities for jobs. We have our TDM program, our Transportation Demand Management Program, which is our van pool program and our carpool matching. We've worked with Davidson County Community College about those mobility options. And so some of those items, we'd like to obviously work more with the county and with businesses because there are some benefits of just education. But it's more than just the bus when we talk about mobility. Our service obviously is providing bus, but we have a regional van pool program. We have some other elements that are really get to businesses and some tax incentives that are in place at the federal level that are incentives for employees. That can be pre-tax discounts for certain employers that would really be fed through their HR departments. And a lot of that is more things that we do and what we want to just deal with a broader education of what those options are. And that was great questions. I can more than happy to answer any other questions or go through any other details. I know you have a very busy schedule. I'll leave it up to you.
Yes, sir. You had, one of the biggest, drawbacks we have of people going from Lexington, to Winston-Salem is the frequency of service.
Yes, sir.
And I try to utilize that myself to go to the VA over there. I can get over there all right, but then I gotta find something to do till about 4 o'clock in the evening.
Right.
So you can't go over there for an appointment and then come back for an appointment. It's just, are y'all gonna do anything when you're changing these routes to, make it more frequent?
Very good question. Yes, with the VA that's now moved into Kernersville, we have expanded our service that is in Kernersville serving the VA and our expansion of that service, because we're on a different corridor, so we're in a different quadrant. But if I can, I don't know if I can show it on this slide, but we have our service that's feeding into the VA that's going to our Coble Transportation Center, and that essentially is operating throughout the day. We expanded that service as part of the Business 40 mitigation. How that ties in with Davidson County and with this particular route that we're looking at expanding, that connection that is going into High Point allows for that service that goes directly into our Coble Transportation Center on the Route 3 service that we have in High Point, as well as the connection that we have in Greensboro. So that connection and when I say connection, we're talking about, our connections between our overall network. So we have a Davidson County route coming from Thomasville going into High Point. There's a connection point there, that feeds directly into the Cobra Transportation Center, and that service that feeds the VA operates higher frequency out of that location. So we have expanded that, with regards to those overall connections and frequency of service. The issue that exists, and I'd say the issue, the only dilemma that's really in place with that, Commissioner McClure, is that transfer would essentially be two transfers, because it's not a direct connection from Lexington, or from Thomasville, into the VA in Kernersville. The service does connect, but it would require a transfer. Now, there's transfers that we have. Yes, those are timed up with our services, that all of our routes are basically, so you're not sitting for days and days, to make those transfers, and we don't have transfer fees. But that is one of those barriers that exist with regards to transfers.
In your expansion of routes, is anything going down, Highway 8 toward the lake?
No, sir. Not, we don't have anything that's going down towards the Denton area, or in, like you said, Highway 8. That's more representative of some of the challenges that exist. We have many corridors that certainly could support having frequency of service, but that gets into a funding issue. And the funding issue is not just Davidson County funding. That gets into federal funds and what federal funds may be available for subsidy that we all have with our public transit service. So the opportunities are there, but it really comes more into a financial package.
Thank you.
I want to thank everybody for your time. I know you're very busy, but thank you so much for giving me the opportunity to be here this morning, and hope you all have a very productive day.
Thank you for the information.
Thank you.
Before I turn it over to the next speaker real quick, if you'll go in your big packet here to page 50, towards the back.
Towards the back, that's pretty specific.
Hang on to Scott's comments there. Just on that one slide, you've just got a brief look at kind of Davidson County Transportation and that Route 9 Scott talked about. So the challenge of having riders on that Route 9, ridership, if you will. So the options piece down below, you see, Scott already touched on bullet 1, where, they get the vehicle tax, as you all know, from us, through the enterprise rental cars, or all the rental cars, I guess, companies and whatever happens in the county. But it goes, the options were twofold at the initial onset of this conversation. Going up 52 to Winston-Salem, which has been a route that's been tried before, and it was not as, again, couldn't get the ridership, and did beef up the marketing, et cetera. Or I think where he landed on, try the route from the park and ride in Thomasville on through into Greensboro. That being said, so I guess the question for me and particularly Commissioner Truitt at the time of the meeting was, what if that doesn't work? What happens if the conversation of one day the county receives the vehicle tax back? What would we do? That second bullet, Richard and I have kind of talked about, I think Scott touched on it, is the what if, could we ever take those funds and run a route from the Welcome Business Park to Egger? You've got a map there, I know it's small, but a little circulator route of what that would look like. So keep that in mind. That could be an option if they ever have to discontinue these routes and we pick up those funds, we could look at running something there. And I think Richard's been in some preliminary conversations with folks inside the business park as well as Egger, and there's some pretty well-received conversations about it. Yep, that might be a good thing for us to do. So just keep that in mind. We'll try this marketing and maybe the park and ride route from Thomasville, but that long term, I got a plan B is what I'm trying to say.
I just got
Go ahead.
I got a question on this route from the business park to Egger. How would you run something like that? Because they work 3 shifts, and unless the bus was running
24 hours.
right 24 hours a day,
And I'm gonna have to get, Richard, if you're here, I'm gonna have to get your help on this one.
at the proper times to handle shift work.
Mm-hmm.
Then you may need 2 bus fulls or 3. It's just a question.
Yeah, that's one of the challenging parts of the planning process. Eggers, when they really kick in operation in the fall, they'll be doing 2 12-hour shifts. I think it's 7 to 7 and 7 AM to 7 PM, 7 PM to 7 AM.
Have office help as well.
Yeah,
You'll
and
have
they'll
all-
work during the day.
Right, so that's gonna be a 9 to 5 or a 8
Right.
to...
But by doing that 7 to 7, it makes it easy for us, because we could schedule the buses to get people worked for the 7 o'clock shift, pick up those leaving, and then get them back, and then do another round at 7 in the evening, and we could work out something for the office staff too. Atrium works 3 shifts, so that's a little bit more challenging. Their start times are about the same as Edgar's, so the original plan was to think about running 1 bus, leave Lexington, go to, Welcome, go down 52, pick up, Edgar's, and then come back. We'll probably do two shorter routes. So that'll increase the money a little bit. The planning team is working on that with me, on what that would cost if we actually went that route. But we did have a really good meeting with the HR departments of, Edgar's, Atrium, Greif, which is near Atrium, and then, RLS, which is one of the contractors at Halyard. And all of them were excited that it's a possibility down the road that we could provide this service. And when I started talking money, no one threw anything at me. So they were open to the idea, either building the shelters in front of their businesses, which are about 10 to 15,000 each, or sponsoring buses or contributing to the cost of it, which would cover the local match. So it's a well-received so far, the idea of it, but we're still early planning.
We need a plan B for just in case these 2 routes don't work for part, and they give us back the vehicle tax money is basically what it amounts to. We need something there in place.
Question about that. When this Board of Commissioners voted for the tax that we have now already, we voted it based upon the service that they were gonna give us at that time.
Mhm.
So if we run into a situation where they stop service and we pick it up, they need to be conscious of the fact that they're not providing the service that we agreed to start with. We don't need to be taxing our people twice. So we tax them on the first time going in, and then they quit the service for a particular area, and we pick up that amount and that route, then we're actually paying for the citizens. I brought this up before, whenever they cut some of the routes, but it's when this board voted, it was a certain amount for a certain amount of service. And they're not providing it now, and if they're gonna cut it even more, then we need to take a look at what we're doing, I think.
Right.
So you maybe have that in a conversation with them when you're talking.
Okay.
Thank you.
Yep, thanks.
Next up, Lillian Coombs. I've asked Lillian to come up and give you guys an update on our substance abuse coordinator position, that we added to the budget, I believe, last fiscal year.
Good morning, everyone. I hope y'all are doing well today. This is a great day for me because I'm here to present, but I'm passing the buck. And I would like to introduce you all to Jonathan Tysinger. He is Davidson County Substance Abuse Coordinator, and he's going to tell y'all a little bit about the program.
Good morning, Commissioners. I'm glad to finally get a chance to meet you and stand before you and kind of give you an update about where we're going. First, I just want to say that everywhere I've went, the community has really been positive about the position that you guys have implemented here and have been appreciative of that, recognizing the issues that we have and confronting it head on. Just to go ahead and move into what we got, because I know you guys are really busy this morning. First off, this is just kind of a snapshot or an update, if you will, of the work that we've done over the last few months. Primarily, the first thing I did was get into the community to immerse myself into the citizens and our community partners to find out what is the problems they're facing, what are some of the barriers we have, and to try to kind of assess the overall problems in the situation. This is just kind of represents some of our community partners that I have been building relationships with, and we have open lines of communication, including Reed back here. We talk extensively. So this is just kind of the base of what we begin to reach out to just trying to assess where we're at. Just to give you a quick snapshot of kind of where we're at with the state and our stats. If you look to the upper left, this is in January of this year. The stats that I get come from the Department of Health and Human Services. They're pretty reliable because of the reporting that goes among. But if you'll look at the top left, you'll see that what I did is I looked at the top 5 counties in January that had the highest rates or the highest counts of opioid-related OD visits. Buncombe County was number 1, and unfortunately Davidson County was number 2. We are actually 5 more in this month of January of this year than we were of last year, so it's actually a slight increase, with Alamance falling right behind us. And you can see kind of where we fall in relation to those counties with population and economic status. Also, the opioid overdose ED visit by age, it still remains in the age group of between 25 and 34 and 35 and 44. Those are the 2 highest age groups that are affected, and obviously that is our working population. Those are the people that are actually out here in our businesses, in our jobs, so that's affecting us obviously economically. The map on the bottom is not specifically to Davidson County, but I wanted to highlight it for one specific reason, and that is a map that actually is displayed on several of their fact sheets that show up monthly when they do their updates. The map is a hot spots that they show amongst the county, or amongst the state, excuse me. And if you will recognize, there's 4 counties that they highlight consistently that kind of show up on a regular basis. And unfortunately, right now, Davidson County is still showing up as a hot spot. It's nothing that I did. That's actually just a cut and paste from their website. So that's just kind of a snapshot of where we're at.
Do we know why?
It's a lot of sociological issues. Unemployment seems to still be one of those.
But we've got a very low unemployment rate, 3.5%.
Yeah, but we do have a lot of people that live outside the county that come here or just don't work, period, or go to other counties for unemployment. That's not the only, obviously, standing reason. I think the biggest reason is because of our prescribing practices for the last 30 or 40 years. That was a huge impact. And now we're trying to turn that tide, and we're right at the front of that right now. So we've really just begun to start doing that. Program goals we have, these are accumulation of all the assessments that we've done. Obviously, successful grant application, because that's what's going to fund these programs. That's what we're looking for. Implement evidence-based programming. A lot of what I do is actually looking to see what other counties in the state are doing, what's working for them, what's not working for them, and what can we implement here. Raise community awareness simply by getting out into the community, making connections with the citizens, making connections with our community partners, and making sure that they are aware of our problem and what's going on. And then lastly, connecting those in need to care, with that being our target demographic of those suffering from substance use. With the overall goal of obviously decreasing the number of overdose deaths and emergency department visits related to substance use. One of the ways we've begun to do that and achieve those goals is through the development of a substance use treatment repository. What I've been able to do is just look at our county and the 7 surrounding counties and see what treatment facilities are available, what rehab options are there, and start putting those together in one source so that we can make a quick reference guide to see what's available. Right now, I'm currently at 70 plus treatment facilities. 36 of those have been vetted by me, either by a site visit, phone conversations, and that's an ongoing process. And when I say vetting, what I mean is not just going to a website and saying, okay, here's a facility, but actually going there, making contact with those people, and verifying that what they're publicizing is actually the services that they do offer. Just a quick snapshot, some of the things that are available whenever someone would contact us to find out what's available for these facilities. Inpatient or outpatient, payment options, do they offer transportation, and primary services offered. Once they decide, well, maybe I'm interested in this provider or that provider, then I can go into a detailed data sheet that I've included with each one. They give specific treatment plans, medication use for like medically assisted treatment programs or MAP programs, their counseling structure, and so on. The way I'm getting these referrals in currently is we came up with the idea to have community access business cards. So essentially what I've done is I've just made myself available to the public. And what I've done is I've had some very plain business cards printed up with my contact information where they can contact me directly. I've dispersed them at the magistrate's office was the primary point of concern. Lexington and Thomasville probation. I give them out at school presentations and at any public venue. And it's basically just my way to connect directly with the public. We've only been implementing this for approximately about a month and a half. We have made 5 referrals so far due to these cards, so it's beginning to pick up, with the majority of them coming from the magistrate's office, where people go to the magistrate's office to seek help for loved ones or friends or family that are suffering some substance use.
Ask you a question about that.
Yes, sir.
What I'm seeing up there is a lot of public options. Has there ever been a study done to equate the indigent needs, those of indigent needs, compared to the private sector, which one's doing the best job? Have you ever seen a study like that? It seems like everything I'm seeing is all around public options. And if the private sector's got a better answer, then we need to start looking there and see what we can do on the private level.
That's a good question.
If we really wanna fix the problem.
That's a good question, and I can't answer that question at this time.
Nobody else can either.
Yeah, so,
Yeah, and see, that's always been one of my things about every year we come up with more money for Cardinal, more money for, treatments and things like that, but each year it gets more. I mean, it's more, the increases, you're showing an increase right here, but with all the money we're spending, why aren't we seeing some reduction? It's because we're not looking where we need to look, and that is the actual fixing of helping these people that need to be fixed that people can't afford. And maybe, and on the public level, we can do some of the things they're doing, you know, because we don't have the answer.
yes, sir. And
I think it's a great step, what you're doing here.
Thank you.
But where do you direct them? I hate to stand in your shoes. I don't know where you.
It's not easy, just to be honest, when someone calls and says, where do we go to, what do we do? You know, the options that we have are, obviously, the first thing I'm gonna do is gonna direct them to services here in Davidson County.
Right.
And then if they're either not available to take those options due to transportation or financial issues, I start looking for other places that they can go because ultimately we want to get people in help. That's the ultimate goal. Obviously with Davidson County being the primary place, we want them to get help in. But, you're correct, sir. That is a difficult question, and I honestly just do not have the answer to that right now.
I'd like to see those comparisons, but nobody has, you know.
I got a question here too, and I know you probably got time for questions later, but what I find hard to believe, that we have a higher overdose, population than Forsyth or Guilford County. Being their population is much more, they have more medical facilities there, more doctors, especially when it comes back to prescriptions. You said maybe the way prescriptions was wrote in the past. It's probably more prescriptions written in Winston in one day than written here maybe all year. So how could that, I just don't know that I understand that, and how that could even be.
One of the things is you've got people that live in the northern part of the county that go to doctors in Forsyth County, but the statistics still show them as their home address in Davidson County.
That would be interesting to know where these overdoses actually occur, where the residencies are, whether it's southern end of the county. If that's the case, they're probably not going into Forsyth or Guilford County for medical treatment, chances are.
Well, I do know, I speak with Major Mark Robbins almost weekly just to kind of keep an update on where we're at with the stats. Excuse me. I know last year in 2019, Davidson County EMS went to approximately 1 call every 12 hours all year long, just in Davidson County. So those were actually addresses in Davidson County they went to. So it equates to nearly 2 a day. Every 24 hours was 2.
How many more people are in Forsyth and Guilford County though?
Yes,
Are
sir.
they not keeping maybe as good a record as we are? I mean, you know, the numbers just don't.
Well, there's a lot of different reporting stats. There is the stats of who goes to the hospital, what calls do EMS go to. Those were just reported numbers as actually that were brought through, that were probably brought from patients who actually were transported to the hospital, because even though patients sometimes call for EMS, those numbers might be recorded or may not be reflected directly in that number, because if they deny services on the scene, it might reflect differently. So the data that was reflected there was just kind of a quick snapshot and not broken down to show reflective of how actually the data is reported.
I would like to see some kind of statistics to how many, like, methadone clinics that we have throughout the region, and where these overdoses are happening in conjunction to the vicinity of close to these areas, because a lot of people who maybe can't hold down a job but are getting these methadone prescriptions, and they're addicted and they're trying to get off, and we've even run into issues to where maybe the physicians and the doctors aren't doing what they do to give them the correct prescriptions and all that. I would like to kind of see what the correlation is, because I know when some of these areas pop up, you have hot spots of ODs and things that go on that maybe not are necessarily related to meth or anything like that, but a user tends to be a user of multiple drugs, not just one. So I appreciate what you're doing.
Thank you. So we've also developed some key strategies about how we're going to achieve these goals. Obviously, they do line up with North Carolina's Opioid Action Plan 2.0, which is to prevent, reduce harm, and connect to care. Public awareness events and education and prevention. This is something that we feel is really important. The first we need to do is we need to identify the problem with the public to make sure everybody has an understanding of it. Community Awareness Conference, we just had one here at the Lexington Y on the 22nd, which has been really great because the Y has partnered with us here and in Thomasville. And whatever type of event we can put on in Lexington, we're going to try to mirror the same one in Thomasville so we can have the same amount of outreach in both cities. Expansion of the program called Get the Facts program. I don't know if you're aware or not of it, but it was a program implemented by DC SPAN to reach the 9th grade classes to give them the facts, if you will, about opioid abuse and substance use. Trying to reach that early age where they begin to explore their community a little bit more. They're out at football games, they're out at basketball games, and they're a lot more socially active, and therefore they're more open to opportunity to be introduced to drug abuse. It's been a very well-received program by the schools. Last fall, since I started late in the year, I was only able to get to 2 schools. To date, we've hit 5, and yesterday I was at Oak Grove with some other health educators speaking about substance use as well. The DC SPAN Coalition Revitalization is obviously, as you are aware, is a collective group of our community members that get together to try to talk about these issues and what are we going to do. We've been challenged I've challenged them this year to do what we can to develop new outreach program development. What can we do besides what we're always doing? I think it's important that we not get stagnant, that we always challenge ourselves to be up to date and try to come up with some new programs and improve the website itself. It makes it a little bit easier for citizen interface to connect with us, to find out what are resources, what can I do, who can I turn to help, just some stats and some numbers. And lastly, as our partnership with the DC Connect Incorporated, this is a collective group here in Davidson County that are working on homelessness, post-incarceration, and substance use demographics. We're utilizing our capacity with DC Connect to reach the justice-involved individuals. Not to state anything I'm sure you haven't heard, but as you do know, those that are coming out of post-incarceration are 40 times more likely within the first 2 weeks they're released to overdose than any other population.
Mm-hmm.
Let me ask you one question, your opinion. It's interesting talking to you. I'd like to sit down with you and talk to you more. When we talk about the implementation of controlling how those opioids are being prescribed, for years we felt like they were being overprescribed, and that was a contributing factor to opioid addictions. If that's true, why do we have 101 more after that's been implemented? If that were true, had been true, why do we have 101 more deaths than we did last year?
That's a good question, but I think I would.
That's a really good question.
I would point to the fact that a lot of times the state uses the term opioid to also include opiates and heroin, depending on how they report.
Mm-hmm.
So whenever they say opioid, it could also include some heroin overdoses as well.
Mm-hmm.
So that doesn't really specifically break it out. That's a good question though, but I think part of the answer would be because of relatively new prescribing practices, where they've changed it to where it's only a 5-day prescription versus the 30-day plus refills. I think that's a relatively new implementation that I don't think we're really beginning to feel the effects of just yet. Because obviously I don't know, I couldn't answer this, but I'm sure there's other states that have different prescribing practices and so forth. So I would imagine there's an influx from other states as well, but that's a good question.
According to the users I deal with, well, not of late, but on a daily basis, it had no effect. It had an immediate effect but no effect because they were able to seek out alternative sources.
Yeah, correct.
And so it's still there, we gotta figure out what's the next step.
What's the next step? Yes, sir. You're exactly right. And I think, with the position that I'm in now, we're just now, myself, just now getting a grasp of what the picture looks like. And we're really just starting to bring together some ideas about what we can do. This is still relatively fresh. I don't have all the answers. I really wish I had more. I'm learning every day though, unfortunately. There's a lot to learn every day. Moving on, did I skip one? I'm sorry. Moving on to our long-term goals, kind of what our big picture ideas are. In process right now, we're working on the development of a post-overdose response team. That's just a generic term for a group of individuals from the community that would go out and make contact with the person who's overdosed within a specific period of time. This is not a new program. It's not innovative. It's been around for a few years. It started in Ohio, basically with the sheriff there, social worker. They began reaching out to people in the community within 72 hours of an overdose to find out what did they overdose on, why did they overdose, what were the circumstances, can we offer more services, can we take you to treatment, would you like to go today, and just kind of get a feel for this. They did begin to see a reduction in numbers. Because of that, some other counties and other states began implementing similar programs to reach out to those who had overdosed within a period of time. Forsyth County actually has what they call the Community Paramedicine Program, which is their development of Port. It has shown some promising numbers as far as a reduction of repeat overdoses. So this is a program we're looking at right now to see how we could possibly develop it here in the county. Another one would be the development of a public naloxone accessibility program. That's a big question. Not exactly sure how we can do that yet. It's a mirrored program or mirrored idea from North Carolina's Opioid Action Plan. How can we implement that to get the public access to naloxone? So these are questions we're beginning to ask right now. How can we do this? And it continued into research, evidence-based harm reduction strategies and feasibility. I know harm reduction is a new term, and I'm not going to touch on it a whole lot. But when you say harm reduction, you start thinking immediately of SEPs or syringe exchange. That's not what I'm suggesting. I'm suggesting we just continue to look and see what other harm reduction options are out there before we do present some type of idea. So we're looking into those right now to see if any of that would actually be feasible for here in the county. And obviously, grant application is always going to be at the forefront because anything we do, we're going to have funding for. So continue for grant seek application.
I got one quick question for you.
Yes, sir.
You said something a while ago. I don't understand. I'm a numbers guy. I don't understand how you can combat an issue or a problem when I think I just heard you say the state categorized all overdoses, heroin, opiate, all under the same umbrella. So how can you pinpoint the issue now if it's not prescription drugs anymore and it's street drugs that they're overdosing under? Without those statistics, how do you know how to try to fight the issue?
Well, actually, they do break down the statistics as far as the type of drugs, but when I was referring to opioids, sometimes the state will lump heroin into that as well because it's an opiate-based product.
Right, I understand that, but like say if it's street heroin, what I call street heroin, I guess, then if you're not keeping those statistics, how do you know how to combat the issue?
That data actually is available to break it down. You can get into the sites to start looking at specifics. I just didn't include them here for just the sake of...
Right, and you know, that might not be the issue that we have locally here, you know, I mean, so if we're not keeping those statistics, and maybe we are, of what they overdosed on and how many times they overdosed, if the same issue or the same person's overdosed 3 times, you know, we need those statistics.
Yes, sir.
In my opinion, to fight the issue.
I 100% agree. And what I have started to do is started to work with Mark Robbins a lot, and we're having conversations about how can we track this specific data so that we can answer exactly what it is you're asking, because those are the same questions that I'm wanting to know. What are people specifically overdosing on? Are they actually residents in the county? Did they overdose here in the county? Were they just visiting you know, I'm wanting to know too, like, if someone comes from, say, Randolph County with some friends and they come to a party and they overdose here, that counts toward our stats. But is that actually a resident here, or are they just
They're just passing through.
passing through?
Right.
Correct. And so, Major Robbins and I are trying to figure out a way we can break that data down, and obviously still be HIPAA compliant and not break those privacy policies. But we're trying to figure out how he can give me data that I can review it. We can make sense of it. Currently right now, the system he has, the data hardware that he has, is not as easy as just punching in some keys and they can pull up specific data. You just kind of get a chunk. You get all the calls, like you type in an overdose or accidental poisoning. Then you have to physically go into every call and look at the data. Obviously, that's time consuming. So we're trying to figure out a way we can actually extract that better to answer exactly what you're doing, because that was one of my concerns. Who are we treating and why are we treating them?
Right, if you don't know, then you'll never
Exactly.
figure it out.
Then you don't know how to develop your programs. You don't know what your target is. So the excellent question, and to answer your question, that's something I'm currently trying to figure out with Mark. 'Cause
And
that's
we've
the-
talked
that's the
about this
best way.
before. If there's HIPAA laws
Yeah.
that are keeping you from doing your job, then maybe we
Exactly.
need to try to get legislation in Washington so we can get that information to treat the problem, if we're serious about treating the problem.
There are some loopholes. Earlier when I mentioned the community paramedicine program, the way, and I don't want to speak out of turn, this is relatively new, but the way they kind of get around the HIPAA law is you have the community partners, like the peer support specialist, who's obviously not EMS. They join the community paramedicine team under the guise of being employed by EMS, and they have some access to some of that data. That's a rough, if you will, kind of guesstimation of how that works, but don't hold me to that, please, but, because I'm still looking into that to figure out how feasible it is for us and if we can do that.
Commissioner Yates, two things, and I'm not trying to be an expert, 'cause I'm not, but Chuck and, Chairman Watford went with me to Raleigh to hear the AG talk about the whole lawsuit, ordeal. And they had a medical doctor there. I think he was a contract medical doctor with the Department of Public Safety, if I'm not mistaken. Correct me if I'm wrong, but that's incidental.
Yeah.
And that gentleman had two things that I took away from my ears. Again, you two can correct me if you heard differently. That, and this ain't gonna answer your question, but this is part of it. That the opioid prescription part of it was the gateway to the heavy duty stuff, from his perspective. And that two, the United States does 90% of all the world's opioids. We use them all, consume them. So that in medical schools now they're starting to change the notion of, in other words, he said, and this was his words, not mine, he's a doctor, that in Honduras they do the same medical procedures for, say, backs or whatever that we do here. The difference is you get an aspirin and you go home. And so, and he had some numbers, and maybe we can get our hands on some of his presentation, because he had some stats as to how people get addicted to basic things like going to the dentist to get, you know, whatever it is, prescription medicine you get for pain, and then that leads to other things. So that doesn't answer your question, I know, and I don't know that there'll ever be hard numbers on how that works. But the whole notion of, in America, we got hooked on this, we have money for this, and that's how this happened, kind of blew up, somewhat made sense to me.
But the way the prescriptions are being written now, the opioid the use has gotta be going down other than heroin opioid.
He had some that was, yes,
Right,
and
it's gotta be going
he
down.
claimed that it's shifting out of that into what I call the heavy duty stuff, but that from his notion, it started, not every case,
Right.
but the majority started here, and we've morphed into this. But he said, what I thought was encouraging about it was there's gonna be a whole generation of medical students coming out of medical school that are gonna take a different approach to this. So in his mind, that's how you fix this. As a tsunami, you change the entire way you prescribe medicine.
Well, that's how you fix that, but then if our problems shift over to street heroin,
Then you got crime and everything, you know,
Right.
you got a whole another set of problems that come along with that. But I'm not saying it was the answer. I'm saying, for at least from my ears, and you two, again, it was a different approach to the problem that I hadn't heard in a while. And from his point, he said, look, I'm a doctor, and I'm telling you right now, I'm guilty of it as well. I've prescribed them, and I shouldn't have. He said, the difference is I'm stopping.
Right.
And I'm going around, you know, preaching the word that that's how it's gotta be.
well, you thought it was the right thing to do at
He
one
thought
time.
it was, right,
Yeah.
right.
So that's what,
Right.
so do you know now where it's at? Are we half heroin, street heroin, what I call street heroin?
It's still mixed, but I do know that, to kind of cap off what he just said, there is a slight downward decrease overall statewide in the overdose, situation dealing with opioids because of the prescribing practices. But since it's relatively new, we're still behind the curve, so to speak, and I don't think that has actually caught up to us yet. We're still dealing with the 30 or 40 years of prescribing practices that we had. Now we just recently, in recent times, have a new prescribing practice. I think it's gonna take us a little time to start coming back out of that curve too. You know, this is a problem we didn't get to overnight, so there's no way we'll get fixed overnight.
I sent you all some numbers too, and you just got it with a link to the state's dashboard for opioid use, so you have the numbers you asked for just a few minutes ago. The other counties, what their ED visits are and the ED deaths. That heat map, and I don't know because I hadn't studied the map, it could be some kind of per capita measure, and maybe that's why our heat is hot. But you're right, the overall nominal numbers are different, Forsyth County obviously and Guilford because there's more population, so.
I've got a question, maybe the sheriff can answer this right quick. What is our choice of drug on the street now? What do you see? And meth, so.
Yeah.
Are we focusing on meth? I mean, I don't know much about the stuff, but is that something that's in our REMA circle that we're gonna try to address?
Yes, the whole, I think the importance of the position that was implemented here was the fact that it's substance use coordinator. And obviously opioids are my primary focus right now, but encapsulated in all that is all issues of substance use because like we've already mentioned, poly-use is a common denominator. One person does not just typically use one type of drug. It's usually different types of drugs with a lot of different social impacts that cause that disorder.
But my question is, if the choice of drugs now is meth, why can we shift it over to meth now? So, cause maybe opiates, maybe that's behind us now. So, to stay on the leading edge, if that's the drug of choice on the street.
So that's a conversation that's worth having. I think it's definitely worth delving into.
System's always behind.
Yeah.
You know,
Well, that's what I'm saying, but we don't wanna stay
Right.
behind, we wanna stay on the cutting edge.
It's everybody, but
And
it's
me and the
hard.
sheriff talked about this the other day, and he talks like this street drug problem is a really big issue here. So if it's meth, and that's where we need to be focusing on at this point, then do we need to go ahead and shift?
I agree 100%, and especially talking about the methadone clinic, and I'm just gonna speak my mind. I don't care what anybody thinks, or if they think I should talk or not, but here's my deal, okay? There's stockpiles of drugs out there, and the drug dealers that have the drugs, they've got probably 6 months, year, 2 years of drugs that we're getting from California, we're getting from all over, and we might have stopped Mexico drugs from coming in for right now, and we might see a change in 6 months or whatever like that. But like you said, the street drugs, the methadone, the stuff that goes on right there, we're a hot base for methadone anyhow because we have a methadone clinic right here. And if I've got a soda fountain, a Cherwine, and people like Cherwine, they're going to go near that soda fountain, a Cherwine. We're drawing people right now to Davidson County because we have a clinic right here. And necessarily just because you're at the treatment facility doesn't mean that you're off the drug. So, and I've actually drove a transportation bus, driving people to Charlotte to a methadone clinic before we got one in the county, and just seeing the individuals shaking and ready to get there to get that next dose, it's scary, and we do have a problem, and we need to keep your office and our sheriff's department and everybody else in our prayers, and we need to do everything we can, and I think that's why we've got your position. But I'm in total agreement with Mr. Yates that we need to be looking at what the hot topic is, and that might have to always change.
Well, a large portion of the opioid abuse is not due to the drug, it's due to the additive. And a lot of that's coming out of China. And that's another aspect of it, but talking about methadone, the methadone clinic we have, correct me, Reed, if I'm wrong about this, but the methadone clinic that's presently here doesn't accept Medicaid or Medicare. So that's the reason everybody's going to Concord.
Yeah, okay.
We pay for it.
Yeah.
$12 has it gone up? It was $12 a hit.
I believe it's $12 a dose.
Yeah.
Yes, sir.
Sheriff may have something to say, I see. Do you have something that?
We have two methadone clinics in Davidson.
We're, Wow.
Does either one of them, I know one of them doesn't accept Medicaid. You know if the other one does? I'm not sure. Cause I sure like to save that transportation cost. If we had one in Davidson County. Yeah. They call the subs on the street and sell them.
Madam Chair,
Yes, sir.
a couple of, things. We're talking about, pharmacists, and we talk about dentists and veterinarians. And veterinarians and dentists have more to do with opioids issuing a prescription than the general physical, doctors, because the doctors have a reporting system that they have to report. It's a STOP program that the state initiated a couple of years ago that only allows them to prescribe 5 tablets on the original. And the reason they come up with 5 is because it only takes 5, really, to addict some people. But the dentists and veterinarians were sometimes issuing the drugs that actually cure your dogs, but they're also an opiate. And they were issuing 30 and 40 pills at a time. And then a lot of the parents were just leaving the pills around, and the kids were getting hold of them, and they were using them. Just a question for EMS, that when you go out and there is an overdose, can you tell what drugs they're overdosing on? Can you tell if there's fentanyl in there? So I don't know how they're breaking it down. One of the things that goes along with what you're saying, if we had one place in the county where anybody could come, no prosecution, turn their drugs in, and nobody says anything to them, sheriff doesn't prosecute them, he doesn't arrest them, we don't prosecute them. They could come and turn them in, and we offer them, at the time they turn them in, a rehab facility. And it goes from there. And the people in Nash County, whenever they initiated this program, it went down tremendously. Because sometimes they would come in and they wouldn't do it, but somebody that's coming in and turning their drugs in is trying to get off of it.
Amen.
So the second or the third time, they may say, okay, I want this treatment facility. Therein your housing and rehab comes in. So far as the naloxone, if there was some way that we could get a dose of naloxone to every family in the county, and one of the ways of doing that is to have an ability every time a pharmacist or a vet or dentist writes a prescription for that, once they fill it, they also give them naloxone at the same time. I don't know what kind of issues we have and what kind of authority we have to do that, but there is a big push at the state. We ought to be able to tap on some money at the state level. But if you spread it out and you got this place to go and this place to go and this place to go, you're never getting it down to funnel down to where you can actually make a referral to a rehab facility. And unless you can do that, you get them in rehab, and whenever they get out of rehab, get them in a facility that doesn't turn them right back to the same lifestyle as they was in before, but gives them a long-term solution to the problem. And you said that we got one of those. Which ones are you referring to?
We have Path of Hope, and then currently that's it.
And it's very limited, and it's mostly alcohol.
They do take patients coming out of Daymark after their detox as well.
I know they have one. Daymark does a good job, but they only have certain limited facility, and it's not a real long term. And I know for a fact, because my grandson went out there for alcoholism, but that's what they generally deal with. But there's a lot of things that you talk about that we really need, but I think that if we had the one point place where they could come to without any prosecution, without any negatives to them at all, they could just come drop them off. The sheriff would agree, I'm sure, that the less drugs are on the street, the less problem we're gonna have. So if they come and they drop the drugs off and get rid of them, sooner or later they're gonna get in a facility. And I think you'll see, I don't know what the statistics are for Nash County, but they're not the only one. There's another couple of counties that have initiated the same program. A one-stop, safe shop, where they can come in, drop their drugs off.
I know Guilford County has GC Stop, which is the exact program you're talking about, where
Yeah,
they go to
two or
fire
three of
departments and they turn it in there and get the help.
There's 2 or 3 of them around, and I'm real interested in the drugstores and the veterinarians. Does the stop program apply to them? Does it apply to every prescription that's written? Does it apply to prescriptions that are written for animals? Those are things we need to know, because the statistics show that that's where most of your prescription abuse was coming from,
Yes, sir.
not to regular doctors.
I know that there is what they call a co-prescribing practice, where the doctor does prescribe the opiate with the Narcan. I don't know if that's a common practice, I can't answer that, but I know that does occur. I don't know if that's law, I couldn't speak to that one or not.
It's not law.
Okay.
In other words, a pharmacist does not at this time have to prescribe, or have to give them naloxone whenever they prescribe an opiate. But that seems like that's something else we ought to be able to do. And so far as the meth is concerned, meth came into this county some years ago, and we set up a meth task force with DSS and Department of Health and school personnel and the sheriff, and we come up with a program to detox a meth house. And it's a very extensive program, because if you go bust a meth house, you can't even take a teddy bear for the kid out of there. You know, it's gotta stop and you gotta detox. And I don't know where that program is, but when we started doing it, we started getting advertisement for what it actually did, what meth did, and the results of taking it, and got them in schools. And, you know, I think that's what we need to do about any of the drugs. But it was really kind of like the service films that they showed just before the holidays. It was very descriptive, and it seemed to work. I appreciate that.
I got a question for the sheriff right quick. Would you say, meth was 75% of the, drug issue on the street, 85%, 90? I mean, I'd like to hear.
I mean, I wouldn't say it's quite that high. I mean, there's still a problem with.
With opiate, yeah.
With opiate.
Well, heroin, whatever, both of those are lumped together.
I mean, there is no law when we go out and administer, if there's Narcan, there is no law. We don't charge them at that point, you know. If there was some way we could force them into a treatment, maybe it might help. But, you know, until they decide that they won't help, there is no help. And it's a strong addiction, it's gotta be.
Amen.
I couldn't imagine what it is, but, you know, we keep administering this, and that's how we tell what drug it is. A lot of times, if it's effective, if the Narcan is effective, you know. But meth is a major issue. I mean, everybody's got it. We're making more arrests and everything, but there's still this problem.
So what would happen if somebody showed up at your sheriff's department and said, here's my meth, I wanna, yeah, I want some help? Would you arrest them there, or would you have to arrest them, or could you say, okay, we're gonna try to get you some help and get with this gentleman here?
We try to get it, you know, we'll try to get them in a facility or something. We have done that. We would try to assist them and help them, yeah.
One of the things about having a safe house at the sheriff's department is the people who have drugs not gonna go to the sheriff's department. You need a safe house someplace else, if you wanna really increase the number of people that are coming. Because there's a lot of people, the law is not, it's just a bad deal. So if it's not associated with law enforcement, and they can come trust the folks and turn their drugs in without being prosecuted, you'll get more folks turning the drugs in, and you know, by doing that, you get them, to where they understand and realize what the rehab purpose is.
We're not so much after the users, we're more after the dealers, the flow of the drugs coming in, and that's what we're after. And
I understand that.
these overdoses, we take their phones, we've got a great forensic lab here, and we're having a lot of good success.
Well, that's a prevention part.
Man, it doesn't matter how many suppliers you take off, if there's still a demand, somebody will bring it.
Amen, yeah.
We're doing other programs, I mean, now in Davidson County, we have a new program that we, Mr. Tyson and I spoke about. We're doing the same program, we're gonna go down to the high school. But we're, copyrighting that program, and they're wanting it in other agencies in the state. It's for the middle school, we're in the 7th grade now, and it's a successful program. But it's about vaping, it's about social media, it's a lot of things that our kids are having problems with. We've got to work on the next generation. You can't force your way out of this problem. It's a three-legged table. You've got enforcement, which we're doing. You've got to treat the ones that are on it, and you've got to train the next generation. And we're working on this, highly. And we're gonna start seeing some successes. This is our first year of training, so you're gonna see some good things come from it.
Just one point, you said you referred to Path of Hope.
Yes, sir.
One of the key ingredients that's missing from a lot of these programs is follow-up. Do you know if Path of Hope works? Because if you haven't followed up and talked to the family and asked them what kind of service, how was your loved one treated, you don't have a clue if it works or not. I know for a fact that on an involuntary commitment of a family that was sent to the facility and then kept until the money ran out, wouldn't communicate with the family, called the family and said, come and get them. The family couldn't go get them because they didn't have the means to go get them. Called the sheriff had to go all the way to another jurisdiction to pick them up, gave them prescription for opioids, and had the sheriff to bring them back to the homeless shelter and drop them off. Family don't even know about it. So somebody needs to start following up on these so-called providers that supposedly help these people that are addicted to drugs, because it's about the dollars, not about are they being fixed. And we gotta quit smiling and saying, hey, that we're doing something. No, we're not doing anything. We're killing it, and that's what's happening. That's why you keep seeing the increase. All you gotta do is walk out on your front porch, and look around. Is it getting better or getting worse? With all the money we're spending, we should be able to say it's getting better. So that we need somebody to start following up and see if these facilities are doing what they're supposed to do. Another facility,
That's what I was asking him, but they bring
the one that you mentioned, they didn't want the person in there because the person had a little problem. They called an ambulance and they said, oh, the ambulance that picked him up, he's out the door. Kicked him out the door, all his belongings stole, he never got his stuff back or anything. People don't see that. They think, there's a real nice facility that's helping people. It's a bunch of bull. And I know what I'm talking about. It's a bunch of bull, and we need some people to start following up and seeing that these places are doing what they say they're supposed to do. And quit calling the families that take care of these loved ones that they absolutely refuse to have any communication with. That's one thing. There's a big problem with how we treat addiction problems and people who are addicted and mentally ill.
Amen.
I mean, that's just a suggestion. If we want to know if it works, we need to follow up on it. Talk to the family after the person's back. So what kind of service did you get? Was he helped or she helped?
I don't think that deserves more conversation. Definitely needs more looking into, for sure. To move forward, because I know I've taken a lot of your time, I apologize. The last three things I'm going to touch on is our long-term goals, which really just cap up everything that you have said, which is increased treatment providers, especially inpatient, because like we've already stated, there's only one inpatient facility here with a limited number of beds. The other one is increased sober living and halfway housing, similar to Path of Hope. We definitely need that. Path of Hope is it in the county, and that's all we have. And then lastly, to kind of follow up with what you said, Commissioner Shell, with we need to increase support and counseling groups such as peer support specialists that can do that follow-up, because there's just not enough of them, and the few that we have are overworked and overswamped as it is.
I'd like to thank you. I'd like to say a couple of things. And I know some of these points that I'm getting ready to tell you about are not solutions necessarily, but it's a part of the problem. I know of a family member that was working with a psychiatrist who was the head psychiatrist at High Point Hospital. And he recently retired early. Every time she saw him, he looked more and more disheveled. And he often said, "You don't know what we're going through with opioids in High Point." And I hear that a lot. I hear that it's coming over into the Thomasville area. I think that's an important point. I want to go back to Casey's gentleman who was talking about the dental issues. And I'd like to know this too, if we could find this out. The dentists over the years have prescribed when you with young people when they have their wisdom teeth removed, give them these opioids, tell them to take them all. They take them all when really they could have only taken one or two and stopped. This is a part of where this is coming from over this time period that we're looking at, 30-year time period. Go to your local drugstore. Look at the number of prescriptions that are in there behind the scenes. I have a personal doctor who said, we no longer can have any pain. And this is true of adults as well. I think one area that we need to look at, not only children and education, but, you know, our young people who are young parents, you know, and on into their 50s or 60s. As we get older, we're taking more and more medicine because we've got aches and pains. I have a doctor that said pain comes with living. We've got to get to a place where we cut down on the amount of drugs we take and live with the pain of life and an aging body. You know, I know these don't change anything, but they're things that are real and out there. I'd like to know if our dentists are cutting back on the amount of pain medicine that they're prescribing. I know some of the doctors are. Is that information available through our hospitals or through our agencies, our doctors as well? Thank you for what you're doing.
Thank you.
I know it has been a year of research and figuring out. I'm so glad to meet you. I've heard wonderful things about you and your connection to the community. I think that's part of what is making you do a great service for us.
Thank you. And I would like to just offer myself up available if anybody wants to have a conversation or talk. That's what I'm here to do. So please feel free to
That
reach out to
could
me.
be one of the programs that this community group with Cardinal takes up, and see how Cardinal can be involved in it, both with funds and resources.
That's right.
To address some of this.
Thank you for your time.
Thank you, sir.
Madam Chair, thank you for all three of our speakers. If we can, we want to take a quick break, before we get started with the, oh yeah, that's all the money I got show. So,
I'll leave it at that.
Great segue.
And for those of you sitting out, we still have snacks. We've got donuts and biscuits.
Don't do that, don't show that thing. I'm phobic of those things, you know.
Okay, I think we're gonna get ready to go back to work.
Thank you, Madam Chair. Every year, this board convenes to talk about the priorities of spending for next year, so we're here at that time again. Before I start, most of the department heads are in the room. We've convened our budget meetings, so we're probably, I think, in week 2. Had a good meeting with, all the departments and some of the big ones we're starting with now. I wanna thank them. All of the requests that I have seen, are reasonable and are also, thoughtful in terms of knowing where we are. The presentation you see today, I also do it for the department heads, most of it, except for special topics in late January. Because I think it's important for them to know where we are and globally, you know, not just in doing technical things involving their budget, but just where we are as a county. So this is the one time a year I can get together and kind of talk about those macro issues. A lot of work goes into getting this prepared. I just want to kind of give you a brief overview of the process. Every year around the fall, I kind of get in my head together of what we're going to do for major projects for the following year and actually for the next 5 years. I work through what our debt service projections are going to be based on stuff we've already approved, and then if there's anything in the future that's going to require debt, start to build that in the model. Get a good grip on where we got revenue sources, major ones coming in, and then on the expense side, we do something a little bit different here than I've done in other places where, and I use the word zero base, if you're not familiar with that term, it means start over. It means build from scratch, take it from the ground up. I zero base salary and personnel in this county. So every year we get all the salaries annualized, we get the pay raises, factored into the equation, any type of adjustments that go through, and we build them in there with the insurance, with the retirement and all those things. So it's starting over every single year and lining them up to the amount of FTEs that this board's approved. We also do the same thing with capital. I use a plug number to show you the projections you got today, but as I go through the process with them, it's always, that's what the budget meetings are for. How many cars need to be replacing, how many ambulances, how many police cars, those kinds of things. And then we start to mold that around as we go. And then the operating budgets, to be honest with you, I assume, which is always a give and take, a no growth budget. And as you can well imagine, that's not exactly realistic in terms of contracts that we approve, that this board approves, have inflators in them. So we have detailed conversations as we go through these meetings, and they can attest to that. They heard me say the phrase, is there any new contracts on this list? Or of the ones on the list, how much are they growing? 2%, 3%, 1%, whatever. So that's all part of the process, and that's what we go through now. So just so you know, to get you a final budget in May. Let me start off. I'm gonna zip through some of these. This thing ain't working.
Let me see if I can get the first slide one.
You've got the packet here to follow along. There we go. The TV screens are for folks in the crowd here, and I'll use the packet myself too as well. So what we start off with, let's look at the current year, and we start off with the major sources of revenue. And the biggest one in the county is the property tax. And so we build the property tax budget by starting to look at the values. And of course, the values now, we're what we call a steady grower in this county. We grow typically between 1 and 1.5% year after year after year after year. Now, EGGR is playing a role into that now, and I've got that circled there. And we're going to talk about EGGR a little bit more later. Mr. McClure asked me about that yesterday, so I've got a whole section for them. But you can see I circled that there. We've got what we think is going to be based on their schedule of work, what they're going to contribute to the tax base here in part of 2020 and going forward. So I just want to show you that. And the budget is never going to equal the actual in the sense of I do my best to hold some funds back. And we'll talk about why in a few minutes. It's always good on the revenue side to be fairly conservative, and on the expense side be a little bit aggressive so that the two don't go like that and get you out of whack. So, oops. Those values lead you to, obviously, the property tax collections. And as you can see, and you're going to see this screen quite a bit in terms of the orientation of it on several slides. You've got a few years of history here backwards looking, and then you've got a projection in the orange bar to the right of where I think you're going to land. But those green bars are important because that's your apples to apples growth from year to year to year at the same point in time. So you get a nice glimpse of, and again, with a dollar amount that big, collections and things like that make the variables move, but you still got January of 2018, 19, and 20 there you can see. Jerry and them are collecting at an astounding rate, and I read in the paper the other day, Guilford County is also doing as well. So that's where you see the 6%, as opposed to the 0.4 from the year before. So we're having a pretty good collection year.
$3.3 million increase in, 1 year?
And again, we're looking at 76.5 there landing point, give or take, and that's my projection. These are all straight projections. Whoops. In our office, with a dollar amount this big, and we'll see this slide as well several times over and over and over, so let me orient how this works. We've got what we call in our office a dashboard, and that dashboard takes a look at those property tax collections. We have one for sales tax, we've got one for salaries for employees. But on the property tax side, what you're looking at here is month-to-month collections. And the blue bars are the projection of what I think would come in every month, and that's based on the past. I took the collections from history that really happened and took our budget for the current year and extrapolated it out over 12 months. We get all of our money, as you can see, in the front end of the year, and that's because of the early, the discount and the things like that. We incentivize people to come pay. And all of the escrow accounts in the county that kind of, have their bank stuff primed to do this at the beginning of the year. In the revenue side, you want that green line, because the green line is the actual. Remember, the bars are the projection. So with revenues, you want the green line above the blue bar, obviously. If it goes below, you got a problem, particularly if it stays below. That's property tax. So the next big source of money in the county is sales tax. And again, much like you derive the property tax from the values, if you look at slide 7 there, you've got what we derive our sales tax from, which is, if you hear a nationwide discussion, consumer activity. Well, what you're staring at is the consumer activity of Davidson County. And it's well above $1 billion now. We eclipsed that several years ago. That is also growing at a nice pace, as you can see, double digits. That is far more than it's been in the past in the few years I've been here. So it has grown. Part of that is because of the state changing the way what can be claimed as sales tax, and part of it just the economy doing much better. So it's hard to know which is which when you're doing this, and that's why sales tax stays. That's a particular source of revenue that you try not to get aggressive with, because it's hit or miss, and it's also based on people's spending habits, which can change, as you know. So most of the United States economy is built on consumer activity, and that's why when we have recessions and people stop buying cars, people doing things, it causes a big problem. When you look at those collections and you go to the next slide, and I know some of these slides got a lot of numbers, so I'll get you straight to the highlights. That consumer activity generates revenue for us. And so what you're seeing here, again, much like the property tax, you've got, year-to-date for January 2018, 2019, 2020. But I've broke this out into our 3 pieces of sales tax. If you remember, a couple of years ago, we had passed a 1/4 cent sales tax, and then the state also enacted an Article 44 sales tax, which can go to education or economic development. And so now we've got 2 more pieces to account for, basically. So I've broken those out, and you can see the colors. The 44 is the orange, and the 46, the 1/4 cent is the green. The 1/4 cent sales tax has been utilized for debt service for Oak Grove High School in large part, and as we over-collect on that, we'll talk about that in just a little while, we're planning on moving some of those funds over to help schools out with their per pupil expenses. But I want you to see all of them together, but also broken out individually. And again, clipping off at the double-digit increases there. We do not, again, budget all those funds, particularly on what I call the base sales tax, which is the Carolina blue bars there. You can see those numbers. We typically don't do it, and you'll look at the top, you'll see where I'm talking about this phrase down payment for the detention center. You're going to hear that over and over and over this morning. There are places where, and I'm going to show you here in just a little while, there's over collections on revenue sources in particular that we're going to, for the next couple of years, get ready for what we want to do with that facility, whatever facility comes out of these conversations. So we're essentially, I call it down payment. We are starting to save for something we want to do. Same thing with the dashboard on the base. I call the base sales tax. This is the base, and that's the Carolina blue bars on slide 9 here. I'm not worried about the 44 or the 46 right this moment, because those things have specific expenditures that they go to. You're simply looking at the Carolina blue bars here. we have a dip every year because we have refunds for schools and hospitals. And on this one, you can see again, the green line above blue bars, and we have some spike months where we have, higher collection rates. Another big source and another gauge of economic activity in this county.
Between September and October, that's the refunds you're referring to?
Yes. Yes. And every year, that can happen in a different month. So it doesn't bother me if October is projected, but next year it's September. As long as I see that I'm meeting my goal, I'm good. Slide 10, next, kind of a big source of revenue, but also, again, local economic indicator is building permits. And again, you see, you're back to the green bars here where you've got 2018, 2019, 2020, and you got a big permit from Edgar there in 2019. And I think because they're cooked in, that's why you're only seeing the 1%, back to 750. You're basically collecting what we collected last year with them included. So again, probably about the same, back to Goodyear having about $1.2 million worth of collections. Keep going with this building permit theme just for a second, because their work translates nicely to looking at the local economy in the county. So there's a lot of parts of what they do. You can get a good feel for what's going on out here. These building permits, as you can see, I circled the bottom number and the top number, so we're well above where pre-recession days. And I do that for a reason. So we've eclipsed that point and we've grown on. And I've kind of backed out Edgar for you there in that little note. So if you take Edgar out, we're still at 7165. So it's a good growth in the county. It's steady over the last few years. But essentially what this slide shows is we've kind of climbed our way out of the recession. And we just did it, really. If you look at those numbers, you really just did it starting in 2017. So it took that long to get up out of the hole that got dug from 2008.
What was the addition in staffing for building and?
Since this time, Steve, you would have asked me that. Since I've been here, I think we've done, don't quote me on this, we've either done I know we've done one inspector. And we've done some part-times, remember?
Part-time, yeah.
And that might be it. There may have been a second one, I can't remember.
And they're utilized primarily for the Edgar project until we.
Well, it depends, because we've got a full-time person devoted kind of to the Edgar project.
Mm-hmm.
But what that does, that takes somebody off the field too.
Right,
so we
right.
play the shuffling thing around. And with the new software, the routing stuff, there won't be any more, we're doing this rotating zones thing we started.
Mm-hmm.
Now it'll just be whoever's closest to the inspection. So it's gonna be decentralized, really, if you will. And hopefully long-term, we'll talk about a building permit system or a central permitting system here in just a little while. Hopefully long-term, we won't have to have as much staff to keep doing these things. But as a recession hits, if a recession hits, or if, I guess, when, this service takes a big hit every time it happens because of their business. And this slide right here, I think, encompasses it all. This is 3 pieces of information in one slide. You've got the Carolina blue bars, you've got the number of actual inspections over, say, the last 10 years, the number of inspectors, and then the number of inspections per inspector per day. And you can see that gap has continued to grow, and that's because we're getting busier. Even though, as you see from the orange line, Steve, we've added staff. See the blip between 2016 and 2017, it creeps up a little bit because we added. But the green bar continues to spread. And this is just something we watch.
We're still below 2008 in 2009 and 2010.
Yeah, I mean, it's staffing wise, but again, it's all part of, we've got better automation too than we had 10 years ago.
Okay.
So we've gotten by with the part-time staff too, trying to fill in the holes. But I just show you this because it's from staff's point of view. We watch the green lines and we try to be cognizant as we move forward. And you can see the local economic effects of things going on in these numbers. You can monitor these things and watch these bars move around. So for us, it's an indicator. Keep going to 13. And I pulled all this, thanks to Jury, pulled this for me a month or so ago, and you just kind of see another glimpse, another way to look at new constructs, plats, and deeds that are recorded out of the tax department. And again, getting back to the same theme, back to the 2008 levels. Keep going on 14, one more on the building side. I think we showed you all this the day we went away from the same day inspections, where we had a nice glimpse of some other counties in terms of not just the inspectors, But the number of inspections per FTE, the support staff in those areas, to try to get how many permit technicians, et cetera, so we get a nice glimpse, try to get a glimpse overall of everybody down there. Remember, moving away from same day was so we, in lieu of continuing to add more people. So it helped us get away from having to always have to get it done the next day, particularly in the summer times. Move on to 15, if you will. So that gets out of the building permit. The building permit stuff, again, it's a big source of revenue. I'm not trying to make light of $1 million, but it's a lot more for the economic activity for me in terms of, I'd like to think at some point in time, if something ever happens in the economy, I'll start to see it reflected there quickly. And obviously, the faster you all can know about it and know what we got to do on our side, the better off you are. Another big source, and again, ties to some of the conversations we had this morning, is the ambulance fees. And you got two graphs here. So you got the fees, and then you got the calls. And you see the calls steadily moving 2-3% a year. And again, that's, I think, large part due to the conversation we just had about opioids. And then the revenues. The revenues don't directly follow the calls, obviously, and some of you all are in the collection business, so you can appreciate this. We run a collection service for ambulance, so some people take a ride and we don't get the money. But we do better than the industry standard, as you can see there in the corner, by 10 points. We watch that number too, because if it ever fell below 70, that's a reason for us to take a look at not having staff to do this and potentially privatizing it out. But for now, we're doing a pretty good job of collecting.
I think we've run between 80 and 82 for.
We've done a good job. Jane and them have done a great job. So it's hard to collect money for people.
That's really remarkable.
That's why I say some of you in the collection business can appreciate that. You don't get 100%. So.
Why is there a decrease there?
It moves around because of the collection. Some months, like a month in this year, you could have had a great month last year. Does that make sense? And it gets off a little bit.
In 2019, there was a 9% decrease in collection.
But that's what I'm saying. It's based on the ebb and flow. You could have had a great December this year and a not so great December last year. And then by the end of the year, it shakes out and you're kind of okay. The totals is really you can see we made more money last year than we did the year before. And so I put conservatively 5.2, but we could by all accounts, be heading right back to 5.4. That's why I say the collection percentages don't tie to the call increases directly. Register of Deeds, this is the same theme of the plats, new construction, and the building permits. You expect to, if you were a logical human being, say, look, if I look at the Register of Deed revenue, I should see more revenue coming in, and you do. 12% increase, and it's largely in the deed transactions. So again, we're seeing more activity, and that's another place to see where one day, if you don't have it, it may be reflected here in these numbers.
So you seen an increase due to the new policy of all taxes had to be paid before transfer of deeds came into play?
I don't know about the specifics, and Mr. Horn, if he was here, maybe he can help share light on it. I just see it reflected in what I call deed transactions. Now, what's making up those transactions, I don't know.
Okay.
But that percentage and that number is moving. It's going up, whether it's by a law change or by just activity. It could be a combination of both. That's it for revenues. Any questions? That's kind of a glimpse of where you are. That's your big sources. You got a lot, and you got one more big one that I don't really touch on every year, intergovernmental revenue. And that's largely DSS and public health, but they are driven largely by state estimates. And so it's not consumer activity, you know what I mean? It's not local economy driven kind of stuff. You get told, here's your number, and you kind of work the expenses to that. So, but those are the big ones that I think really affect the county. Oops, go to the expense side of the equation. And our major expense are employees. This dashboard is the opposite effect of the revenues. You want the green line to be below the Carolina blue bar. If it consistently is above it, you don't have enough budget to pay the people that work here, basically. So, again, now, one interesting thing about this, in the past when we've showed you all this, the green line has been a little bit more below that. If you look at the note at the bottom, you see my expected budget at this point in the year was, just under $22.5 million, and I'm at 21.5. So the difference of, or 21.6, my $600,000 difference, what I'm trying to indicate there, remember we did a pay study, and we enacted those changes in August, I think it was. So we put some money in contingency in last year's budget in case somebody had overages in their department, so we could bring it to the board, move the money around and make it whole. I haven't had to do that yet, is my point to that slide. But it's tighter, so we're still only, our difference is 600,000, but we basically have consumed the pay study within the department salaries at this point, which is a good thing. That means I haven't had to touch the contingency money I put up for that. Now, we're gonna have year number 2 of the pay study coming again, probably again, late July and August, with this round being mostly sheriff department folks. What the total will be at that point, I don't know. We'll talk about it in a minute. I'm gonna go up on the projection what I think I need for year 2. But I just wanted you to see that. And every year at the bottom note there, you see this phrase vacancy rate. What that means is again, go back to what I said earlier, we start with programming all of the salaries for people that work here into their budgets, step 1. And then for those bigger departments, you can't do it so much for small departments like county attorney or county manager's office because we're fully staffed. We don't have anybody come and go. But in the bigger departments, and it's a handful, DSS, EMS, some in the sheriff's office, we put in a vacancy rate. And what that means is you load all the salaries in, and then you put a negative number at the bottom of that as your hedge against what you think they're going to run in terms of vacancies. Does that make sense?
How do we factor lapse salaries in? No.
Well, the lapse comes if they clear the vacancy rate.
Okay.
You know, if like, so for example, if your salary budget's $5 million, but I think during the year you're going to average, and remember, it's people coming and going, you know, all different times of the year, but I say at the end of the year, I think you're going to run 100,000 in vacancy rate. So I may put the negative 100,000 in there. Now your salary budget's 4.9. But if you don't have that many people come and go, you clear it, you produce what's called lapse hours. Does that make sense? Mm-hmm. And what we do with those lapse salaries typically is we wait till the end of the year. If there is one-time capital needs or things like that, and that's the key phrase, one time. You know, I need a computer, or I'd like to do it to replace a vehicle that's got 200,000 miles on or something like that. We may go to the lapse salaries and take it out and use those things. That's basically taking it away from what would fall to PVB, if that makes sense. So but the whole county-wide, it's $1.2 million worth of a vacancy rate that I program in from the get-go. So it's like deducting positions out, basically, if you want the truth. Go to slide 19. Again, a lot of numbers here, but just a quick reflection of where the past has been and what I think we're going to land on now. What I draw your attention to is down here where I've circled in red. This board, we've made 3 changes. You see 3 bullet points. If you remember back in the fall, we added a telecommunicator, we added a school health nurse, and we've deducted 1 SRO from DCCC, from grant funding changes. So that nets us out back to that +1. But you can see the number I've circled there, and if you look to your eyes to the left, where remember last year we brought to the board in the spring, moving money from basically from this pot here into capital reserve, again, to get ready for any detention facility possibly we're going to do, plus funding our capital plan, which we'll talk about in just a little while. So I circle that 7 because at some point this spring, be on the lookout for, again, another move. The capital plan now, because of the size of the estimates, it ain't fully funded anymore. So cash has got to get in there. This is some of the source of where it's come from. And what you're looking is like a panning for gold. You're shaking out the revenues and expenses together here because the top part's revs and the bottom part's expenses. I'm going to show you where that source comes from in just a few minutes, largely. This is just a trend on where our budget, how our budget in the general fund, I'm talking all general fund, today's general fund, by the way. No landfill, no sewer, no transportation. Those are all special funds that run on either their own source of revenues or a tipping fee that they generate. And we can sit here for hours and go through each fund, but general fund is the big one, so that's what you're staring at. That's what this is. So and the good thing about government is our spending is very predictable. We buy the same things every year, year after year. And we spend largely the same amount on personnel month after month after month. The only caveat to that is claims and insurance, as you can imagine. So that moves like this. But our spending is so predictable, it makes my job a lot easier. I can make good, informed decisions about the future, which is really more important to you all than where we've been. But our spending track may be a little tighter. It's a little bit more on year-to-date, a little bit higher. Probably end of the year will be about the same as normal. That's it for the current year. I did that in just a few minutes. Anybody, any questions on that one? Because where we are now is we're kind of used as information for where we're gonna head. That gets us to next year. So again, let me start with the revenues. Let's take a look at where we're gonna build next year's budget. And so I circle in red there the changes column, because what you have is a comparison of last year's budget, or the one we're in now, and what I call the estimated 21 base budget. And when I say base, I mean, I'm gonna show you this in expenses in just a second. Things that we're gonna try to include in the budget that you'll see in May, that I hope at this point we're not debating about much anymore. And so if that's kind of the goal of today. And then we'll have peripheral things that come in, obviously, as I go through the meetings with them. But we're estimating, again, solid growth on the property tax, hovering in about the 1%. We're gonna move the sales tax numbers up just a little bit, the base sales tax, again, because we are collecting at a higher rate. The drop in intergovernmental revenues, let me explain that one. And the school folks are here, so I've been kind of meaning to let them know as well. We have, and I'm just using round numbers, we have in our budget, and have had since I got here, we utilize just over $1.5 million worth of lottery money from them to cover old school debt. Stuff that's been on the books forever, and we'll show debt bars here in a few minutes. So stuff that's we already been approved by previous boards eons ago. At some point in time, that debt will continue to get paid off, and it will go away. So as you can imagine, I keep taking the money, but the expenses keep going down. At some point in time, that's got to change. So I've made a commitment to myself. Every year I'm gonna get 150 out of that number, and by the time 10 years goes by, that'll be about the time they're done paid off. It'll all be even Steven. But if I don't start now, if I wait till the last minute, I'm gonna be sitting at $1.5 million hole one of these days and not having a way out. So I'm gonna take a little bit at a time, if that makes sense. Go to the sales tax down here again. We'll move the base up a little bit. The other two articles, and I'm gonna walk through them in detail later, but I'm gonna take those two change amounts, and if you see it right there with your eyes, 393 and 410, and I say change amounts, I have not, and because I didn't know, when we started both of these articles, I had no clue what was going to be given to me. NCACC provided me with estimates, but they ended up being higher, again, because of the economy and the changes at the General Assembly. So I for lack of a better term, sandbagged some of those estimates. So now I'm gonna move them up. And part of that delta I'm gonna give back to the schools and their per pupil. We've done a good job, I think, of taking care of them on their capital. You know, we didn't run the bond, but we've done more cash into capital for roofs and HVACs. Now it's time maybe to shift the attention of these delta pieces, and I'm talking the delta now, over to the per pupil side. You know, we've all seen the financials in their books, particularly for the county, so they probably need a little more help on that. So that'll be coming in the future. Where we normally give them, and I call them points. I talk like it's maybe in the stock market. Typically, I've been giving them 1% per pupil. This year, I may give them 2 points. This basically, as you can see, almost 800,000 equates to 2 points. Ambulance collections. So, Mr. Yates, I'm gonna move the estimates up a little bit, because I think I'm collecting better, and I'm gonna bet on that I'm doing better collections. I'm gonna move the building permit revenue up a little bit. I'm gonna move the ROD revenue up a little bit, based on those slides you saw. A little bit more on the interest, because I'm collecting pretty good interest as the feds change their interest rate. I'm collecting more money, or I'm getting more money interest-wise. And as you can see, the big one right there at the bottom, no change in the fund balance to start off the year. That's key. So I make all these changes, but I don't move that number till last, because that's the number, that's the plug that makes it all go. If you're moving that number north, that's how you know, oops, I'm probably spending more than I'm allotted to. Now, if you're going to move it for a good reason, because you're trying to cover some one-time expense, that's fine. But I leave it alone on purpose, and I try to build a whole budget around that without moving that number to the dead end. You take that growth there that you see, 3%, and if you carry over to side 23 and put it at the top, here comes the deducts. So here comes the expenses. Take that growth in revenue and just take this slide right here, and now we're just going to back off everything we plan to spend in what we call the base budget. We start with personnel, so we build in the pay raises, and if you see that base right there, that's just changes we've made, you know, whether it be through the pay study or through stuff that's been on the agenda, you know, reclassing positions, et cetera. It don't move much, as you can see. We don't approve a lot of those things. We don't have a lot of changes. But then we build in the pay raises, the COLA for there, and we'll talk about COLAs in depth here in just a little while. It averages out to just under 3, and you remember it's the 500 and 1.5%. That costs about $1 million. I've got to go up on the retirement per the Treasury's office again for another year at a substantial amount. They have, I say they, like I talk to them every day, but through these letters and correspondences, it looks to me as if I get over one more year, I should be okay, and we're leveled out. That's to get all money flushing in the Treasury that they think they need to handle retirees. So, I'm praying that way, because you can see how much the delta is on just moving up to cover the percentage they send me.
So that was a state issue from,
Dale Falwell's office sends that out, right, and they tell you, you need to be putting this percentage in for regular employees and for LEOs. It's not really a negotiation, they just send you a letter and say, here it is.
So
Now,
why did this fund get in such bad shape that they need a 14.1% increase?
you have to ask them, I don't know, that's on the state, I mean, the way.
I'm sure you probably read about it, I would guess.
I mean, how solvent it is, and I don't know if it means they're not solvent today or the future. You know, if they're planning on banking on, we got this many retirees coming in the system and we just don't have the funds based on the percentages they were, be my hunch, if I'm just a guessing man. But what they've done, and I do appreciate this, is they don't just send you the 1 year, they send you a projection. They say, all right, over the next 5 years, in case you gotta move 2 or 3 more, but after that, we're good. And I'm banking on that, because I can't go $600,000 every year after year on this. So I'm clearing the hump, and then hopefully I can stop. Next year, I'm praying you won't see but just a little bit of a jump on that next year, because we'll be at the numbers. It'll move marginally, if that makes sense.
Think it'll still be at 14% next year, or somewhere around that?
No, I'm hoping it'll be lower, because they won't go up on their rates very much. If it is, instead of moving up whole percentage points, like going from 8 to 10.5 on LEOs is a big jump for 200 some people. Maybe it'll be 10.15 or something like that. If that I expect, and that I can handle. But that eats into my base budget capacity too, if that makes sense.
And another 10.5% for group.
That's right. Well, the insurance, a twofold problem on this. I think I can explain this easily. Part of it is my fault. So you got the claims growth. And those of you that sit on the insurance committee, Mr. McClure is well aware of this. You got straight, regular growth in claims, probably to the tune of about 6%. Is that fair? 6 or 7. But you can see the percentage is higher than 6 or 7. Every year, I get a estimate from our brokers that tells me, based on all of the contracts that Blue Cross Blue Shield needs to run and administer the programs, based on your claims growth, you're going to land on this number. And every year I've looked at that number, and it took me, and I apologize, it took me till this year to come to grips with this math. That is the net number that they think you're going to receive after you get incentives back from Blue Cross Blue Shield, after you pay out your claims, et cetera. The problem is I budget on gross. And so by doing that, that fund has a reserve tank. I have eaten into that reserve tank. Now, that has helped the general fund over the last couple of years. It means the general fund didn't have to pay out all that I should have budgeted. I am playing catch up for that math now, because I've finally caught on to it, and I'm going to move the insurance fund up to about $12.5 million. And that's probably pretty close to the actual, what the real gross is going to land on prior to everything getting backed out.
And where's it at now?
About 11.3-ish or and a half.
Are you trying to get it to what, 12.5?
Yes, 11.385, and I'm gonna get it to about 12.6. But my point is, it's the same concept as the retirement. I'm gonna get over this bump for the math. Next year, my growth won't be but just a little bit off that bump plus the claims. That makes sense. So it won't be 10.56%.
You're just trying to use this year as a
I got to get over what I should have done. I hate to say it like this. I got to go whatever I should have done 2 years ago. Now, it didn't cause any harm in the sense of you had $2 million, or at that time you had $3 or $4 million worth of reserves. We're down to 2 now. That's okay. I mean, there's $2 million sitting in reserve in that fund.
Just going the wrong way.
It's going the wrong way. It helped the general fund. Part of your fund balance additions you see every year in the CAFR has been as a result of that not being fully stocked in at full bore. But I'm going to have to do it now, because I can't, when that fund goes to zero, what pays for that fund is all the other ones leeching off of it, if that makes sense. So at some point in time, if you don't get the rates right, you're going to pay the price. You have got to get it up. This is the year I'm going to bite the bullet and do it.
And that group insurance is one of the areas that directly affect the numbers here, because if we do a better job with generic drugs, if we do a better job with, seeing primary care instead of, specialists, then our costs go down.
Right, and that's why I kind of pointed to you when I said that, you know, the growth in the claims, 6 to 7, is actually not that bad. That's pretty much kind of a nationwide thing. A lot of people are seeing 10, 15%. So this jump underscores the notion that the claims are not quite as bad as they seem, if that makes sense. This ain't a claims jump is what I'm trying to say. Part of it is a mathematical correction jump. That gets to the personnel piece, so we load all that in. Now, these ain't no new positions. This is no new positions growth in this, so remember that. This is just what we got right now that's been approved. Go down and you see operating moves, and we'll talk. A big part of that is the jail. So by us putting inmates in other counties, by us having more medical expenses, more laundry, more Airmark food, you know, we're running higher contract prices in the jail. So I've already accounted for that and tried to load that into the projection. One of the things on the medical, and we should have this on the agenda, maybe, I can't remember if it's Tuesday night or the...
It's Tuesday night.
Okay, so we've got with Southern Health Partners, and I think, again, I explained this fairly simply. A couple of years ago, when the jail numbers were down, we gave them that number and said, here you go, you know, we want to have our budget built on 320 or 335 or whatever. Now we're at 3, averaging at some months, you know, 360, 370, but there's a payment for per day for every inmate above based on the contract now. I'm basically going to buy the stop loss to get me up to the 370, probably pretty much closer to where I'm running. That'll actually help us save money over in a year because we won't pay as much to Southern Health Partners. We're buying peace of mind, and I'm pretty confident 370 is probably going to be where we're going to hold for a while. So anyway, the jail's going to be the pieces driving that up. You got the pieces for the school there, the operating again, as I spoke of. You got the debt broken out by pieces. You all always ask me, you know, how much debt's coming off? Well, you can see right here, you know, the current debt coming down and then adding it, leaving it sit there. And I'm going to talk about debt here in just a minute. I'm going to leave it sitting. I don't need this much debt service for next year because we don't have courthouse payments to full tune even next year. But I'm going to leave it sitting at $16 million to get ready for trying to get to $18 million on a $53 million jail. It's also a place where, as the year goes along, if there's places that need funds moved around the county, and where there's a source that you can go to, that you, again, are not hurting yourself. So that's that.
I got a quick question.
Yes, sir.
And I'm sure you've answered this for me before. Medical expenses in the jail. No recourse of getting our Medicaid if the inmate would have to be on Medicaid or Medicare. There's no recourse to try to...
Not that I know of. No, we've checked into this about 3 times, and no.
Okay.
No. So I'm gonna get the expenses up in the jail to match reality is that point. And then if you see my little note at the bottom back there, if you see that growth, I've got an arrow pointing to it, $1.5 million jump. But if you back out the pieces for the court there, the debt service, I mean the budget's down. It's estimated to be down. So, and again, a penny's $1.3 million. I put that as a reminder for that. As you can see, the difference goes to hash. That's balanced. So you took all the revenue from the previous slide, and we apply it to these things, and that's what I'm calling base budget. No ads, no changes to initiatives, no different programs, et cetera. Just
everything that was increased was spent.
Everything that was increased is spent on these items, and it's over. If you go to 24, now you're getting a glimpse, and now we're going to talk just real quick about debt service and those little specialized pieces of the sales tax.
Has it ever been determined, just real quickly, on what Mr. Yates was referring to on the medical expenses and Medicaid, exactly what we would say that the state done their part?
I have not. I've never seen those numbers.
Seems like we're getting dumped a whole lot of things.
I have, and then I was going to talk about that. I'll stay the jail for a minute for us. Some of us that went to Iredell County, for those of you that didn't, I'll touch on the jail, but no, I've never seen anything like that.
He brings up a good point. Let me ask you this question. If there's state inmates on hold to go to a state facility, does the state pay the medical bills?
I think so. Charlene, aren't they in the safekeeping program if they're a state inmate?
We pay.
But do you get reimbursed back anything?
Not to my knowledge.
Okay.
See, that's,
Monthly bill for all of our.
Went into safekeeping.
For safekeeping,
I thought they went into that.
it does, but it all comes back out of our medical budget.
And they don't give you anything back for that piece.
somebody needs to check on that, because
Never give it back.
I don't see how that could even be,
Terrible.
Yeah,
It looks like they would have to
bill me on a monthly basis.
Unless they're accounting for that in the, how much you get a day for a state prisoner? Is it 40?
Yes.
Unless they're accounting for medical expenses and that, which would not be fair.
no, you can't
But
do
I
that.
can hear that being their saying, you know.
Because we pay how much when we send them to another facility for keeping? We
It
pay-
varies. We've got different agreements. Some of them are 40. Chuck, you may know. Some of them are, I think, one of them's 45.
So we're
yeah.
paying 40 and 45, plus we're paying the medical expenses
Right.
for that inmate.
And one
So
part of it might be, I can see it being hard for them to determine how much that would cost. It's, you know, it varies. You get the guy again with the hemophiliac case we had a couple years ago. Depends on the length of stay.
But if that would've been a state patient, they would've owed us $150,000 for,
Oh, yeah, I mean, I
for his
don't,
medical expenses.
it's definitely be an incentive for me to be able to send them an invoice and say, this guy was yours, you know.
Somebody probably needs to
We talked to
triple
our-
check on that and
yeah.
see. Wouldn't think they would be, not responsible for.
I agree, that's a catch-22 on that, and that's a catch-22 when they make us hold them state inmates, and then they penalize us for being over the amount of beds that we have. So
Call
we
it
need
not
to call on both sides.
Call an unfunded mandate,
That's right.
and they're regular and frequent.
So we paid a lot of money out of this.
Oh, yeah, oh, yeah. On this slide 24, you're looking at a snapshot of this Article 44 sales tax. When we got this a couple of years ago, and some of you probably remember saying this over and over and over, the state went in their infinite wisdom and basically took some funds from the larger urban counties and gave them to the rural counties. They just basically redistributed the sales tax. We were one of the big winners in the rural county sweepstakes of that. So they put the earmark on it, though, hey, you can only use it for those things at the bottom. When it had no clue, first couple of years we collected it, how much was coming, nobody knew. So now that we're probably 3 years into it, I got a pretty good sense. And as you can see, from me circling it and writing the note right there, next year's budget, I'm budgeting what we just made off of it. So I'm kind of following along what has actually happened. But those items there are change amounts, and they're mutually exclusive. Mr. Yates has asked me this before. These every year is kind of what you're spending on that particular item. But some of it covers the gamut from, again, paying for part of the per pupil change, the delta, covered into this. Some of the, last year when we gave them more capital, covered in this. Our contributions to EDC, our contributions to the chamber. I've even now, at this point, put in, what the county puts in from the general fund to Davison Works. You know, because I'm classifying that as economic development, people getting jobs. So what we give to the airport, again, with it being an economic part of the county. So I think I've probably unloaded on this source of money everything the county could do that falls under one of those bullet points. I circle the top part to show you, after I've done all that, there is what I call, I'm going to move funds to economic development reserve. And you can see over the life of this thing, it totals a little under $900,000. In the past, we've done that, and if you remember a couple of years ago, the county schools came back and had problems and issues with HVACs and water towers, cooling towers, and we were able to give them the funds. That's where it came from. And so, but one of the things that we'll be saving up for as we put it there is economic incentive payment to Edgar as they come online. So and that's happening as we speak, so.
Do you know, have any kind of idea, of course, they probably don't have any idea at the state, but there was consideration in this past budget of a pretty big bond and coming for capital to the counties. Did you get any numbers on that?
I never did. The schools may have better than I do. There were two pitches on the table. There was a notion to, I think, have a way to give it to us, to give to them, through their regular capital. And then there was a pay-as-you-go scenario for them. I think, the last I heard, they were leaning more toward the pay-as-you-go part of it, which means every county will get some allotment out of that. But no, I think it all got stalled with the budget talks and just kind of. Yeah.
Bottom line, if they pass it, either one of them, it's gonna move these numbers, our revenue numbers up.
Right.
I got a question for you, Casey. I-85 Corporate Park,
Mhm.
$250 a year, $250,000 a year for interest?
That's your red leg. It's not the interest, that's the payment.
Okay,
Remember, that's
that's
at
the-
0%,
I got you.
$250. Yep. So I'm paying for it with this money. So again, anything that shows up on this list basically ain't county money. I dumped everything I could find that met those 3 bullets at the bottom onto this money.
Okay.
What that does is that leverages out county money in the general fund to be able to help us do other stuff.
What was that, a $5 million, is that right? $2 million.
Yep. And it's 0%, you know, you say, well, we could pay it back.
Right,
but
right,
it's 0%,
right.
so
Okay.
it's, might as well just use these funds and.
When I seen that, I was thinking that was interest and debt, but I remember now that,
So that's the 44. Flip over to 25, which is,
Wait
for
just a
me.
second. Let me ask you a question.
Yes, sir.
You've got down here for, annual contribution to North Davidson Chamber of Commerce,
Yes.
and then Lexington and Thomasville, that accounts for the boost that we gave them for the buy local?
Yes and no. Remember a couple years ago, we took it and kind of subdivided amongst the 3 of them. The buy local basically got distributed, I believe, between the 3 of them, kind of, sort of. And then you've got the membership piece tacked on to that. So I think it's
When we did that-
decentralizing the buy local.
When we did that buy local, it was supposed to be temporary, wasn't it?
Yeah. I mean, and
We don't wanna be like the state, there's nothing temporary at the state.
And that's well within the discretion of this board to make changes to it. I have not accounted for any change like that thus far. I mean, at this point, this is what I plan to do with them,
Okay.
is keep that in place. And,
here's one issue, when I look at that, and whether you decide to give it to them or you take it away, but why would you not fund all of them the same if you were gonna fund?
that little bit of that move on that other one was the membership piece of that, and I never got a bill from North Davidson to join, so however that worked. The first year we did it, I can't remember exactly all the details, but everybody agreed to, this was spreading the buy local piece here. And then there was a membership fee for Lexington and Thomasville tacked on to that.
Okay.
And again, I'll go point this out, you, look at the EDC numbers right above it. This thing assumes no growth, as you can see, them numbers don't change. So if we ever decide to make, in this room, when we make choices, and it's not, I'm not saying that to be mean or anything, I'm saying if we make changes, they impact this stuff, you know, and they move it, but, and I don't know if we'll ever be able to fund EDC at any point any higher. You know, we've talked about marketing, I don't know, that's a good question for the future, but today, as of today, I can't, because as you saw from the previous slide, once we have the growth in the revenue, it's stretched out just doing the things we're gonna do normally.
Why don't they just use the funds they have now for
And
marketing?
that's possible too, they do have a reserve
I
balance.
think they got $1 million or so dollars in
They
their
do.
fund balance, so.
I think if we're continuing to, at first, whenever we had that, we, had an accountability report of what they were spending the money on. And we haven't had that in a while. And if we're breaking the money out and spending X amount of dollars just for buy local, we need to know that it ain't just supplanting their funds, that they are actually spending the money we gave them.
That's right, I remember Burr coming by a couple of years and talked to us about, yeah, it's about time for an update. And they've had transition at the director level, as you know, president level, so we'll get somebody, we'll get them up here. Joe can come by. But I wanted y'all to see this in terms of our planning strategy around here, almost inevitably for things that just almost assume no growth movement on these things, and that somewhat ain't realistic, you know, it is and it ain't. You know, we do every year a budget process to trim it back, but, you know, it's tough. The next slide, 25, to me is the best one in the whole deck, because it's our whole organization in one place for me. So go back to those debt service numbers, and I referenced 2 numbers. I hope you got it in your head on this one, 16 million and trying to get to 18. So look at the left to the right, and it looks like a big roller coaster. You got the Carolina blue bars coming through. That's your existing debt. That's all the debt that previous boards have approved, and this one as well for the courthouse. Courthouse is now part of the Carolina blue bars, because it's real, it's here. The green bars are Oak Grove High School, that you have a source of funds for, as you know. So not as worried about that one, but it is included, so it's part of the total. The orange piece is coming from stuff we haven't done yet. from our capital plan, and it's basically the jail. Remember, a couple years ago, it was a handful of things. The 250 you just spoke of is built into the Carolina Blue Bars now, because it's real, it's here. We're gonna have to make a payment. But the detention center is obviously in the future. So that's the orange piece, and we got control over that today. I want you to see that. So look at the 20 budget, you had some orange, but in 21 and 22, no orange. We're gonna talk about that in just a little while. We don't wanna anticipate, we're pushing toward October 2022, and probably some debt coming on for a jail or whatever we end up doing later thereafter, but nothing right now. So
the orange is really projected new debt.
right,
correct?
and it's
Projected.
gonna be based on some logic here in a minute, but is no need for it next year. Now, you could take that out of the general fund budget projections. You see what I'm saying? You don't need it. But the problem is, if you take it out and you spend it on something else, once you try to put the jail back in, you're stuck. So we're gonna leave it sitting there, and that's why the bars hold firm for 2 years in a row. They kind of lock in. You see, you gotta climb that peak. You're headed to that 2023, 24 peak. You gotta get to that point. That's the jail, as you can see from the orange bar, pushing it up. So you gotta get over that peak, but because the Carolina Blue Bars starting to fall off so good, and part of that is thanks to this board signing off on the refinancing, about 4 years ago? Where you saved all those money on your refinancing your GO debt. That's why you're getting some of this, plus paying some of it off. But you see how rapidly it falls. And you see, I circled it there for you. When you get to the back end of this decade, you're gonna have only an $8 million debt service budget. That's half of what you have now.
That's awesome.
Well, it's awesome. It's great news, because as a board, or whoever's in these seats, going to have choices at that time. And I'd much rather in life have choices than my decision made for me. But in some counties in North Carolina, these bars don't move like that, and your decision is done. When these bars don't move, there is no more talking about it. It's over. But you've got that ability. You got a big open space there where I wrote that note, where things change. The trick is, and Mr. McClure said this to me one day, and I ain't forgot it yet, you need to push everything you can to that open space. So we're trying to push, by helping the schools out, from my perspective. I won't use the phrase Band-Aid, because that's not what it is. I mean, it's a substantial amount of money. Helping them with their roofs and air conditions, and of course, like we did the other night with Lexington, we let them do the energy savings program, where they can get money themselves to do it. And I think the county's looking at that as well, if I'm not mistaken. Or you guys have already in that process. So we've helped. We didn't do the bond, and the bond obviously would have been the injection fast way to do it. But we've done it through cash. But there'll be some more school needs, and obviously coming, and if we can get them to that time frame, we got a good shot of handling it. So I say this is, if anybody in county wants to know where we are, this bar's right here. This slide is about as good as you're going to get in terms of getting everybody to understand. The detention facility, we'll talk about it in a minute. It is what's driving the orange, and the other thing good about that too, most of you remember, we used to have several bullets in this top right-hand corner under this orange part. The business park, at one time we had radio system on there because we were talking about borrowing money to do it. It's down to one thing now, which is a credit to you all, because you've cleared the deck with major projects in this county. Courthouse was on this list last year. You've cleared the deck to put your attention onto this.
I just want to clarify what you just said, because I think the board has been very diligent in trying to research options, but we could not have done it without you and our fine staff. So you guys deserve a lot of credit for this.
Well, I mean, it's these folks too. I mean, they hear this speech as well every year, and they know where we are. And I think they know what we're trying to do.
That debt off.
We're also not trying to build a jail on the backs of employees or services. As you can see from the slides, we're doing our best to take care of all the needs. But we're make no bones about it. We're trying to do it at as low a tax rate as we can possibly pull off. So.
I'd like to see every place where we're donating money, or where we're putting money out and we're not directly getting a service back for it, and see how much money that. Cause I was thinking with that stuff on the jail, if we can do something different about that, and with the schools, Chamber of Commerce, and we should get something about that. I seem to think it was like 24,000 for Lexington, 24,000 for Thomasville at the time, and now I know we split the North Davidson in there, but if we're just donating money, I don't have any problem with paying the initiation fee to belong to the chamber, but we're just donating money, and if
Well, I
they're,
mean, I guess the theory behind the buy local, at whatever time, and this predated me,
but if they're doing anything,
You know,
it
the-
doesn't predate me.
the marketing of buy more, you know, that's really what you're buying, and,
Yeah, they were buying billboards and everything else, but
Right.
I haven't seen anything lately that has buy local on it. But anyway,
we'll get Joe up here, and actually, we may get all the chambers,
Yeah,
because they're
like
all
he
part
said,
of it.
I
Yeah.
think a list of all the people
Right.
we're paying, whether they providing services
Yeah.
or not, let's look at them and see if we think the services outweigh. I know the DSS, some of the DSS employees just found
Right.
something the other day that we wasn't getting the bang for the buck, you know?
Right.
So, if they hadn't been digging into it and looking for it, so with that list that you're requesting, maybe we could lay our eyes on it.
appreciate it.
So I third that.
Me too.
They've got to pay for the jail, I hope.
I don't know,
It all adds up.
it all
that's for
adds
sure.
up, but,
You're right.
Commissioner McCormick, I'll put you on the spot again, because you've asked me probably more than anybody, where's the Egger money fall into this? Where's the Egger money? He asked me yesterday, so, I'm gonna show you a slide. So, this is real macro, but I just want you to see it. So go back to those property values just for a minute. The very first slide, remember that in your head. And remember that we've got over collections and revenues and we're gonna use those to bank for a down payment on this potential new facility. So what you're looking at here is the property values. And remember, we're gonna owe Egger an incentive payment. They're gonna pay their taxes and we're gonna give them some incentive payment back. So what you're staring at here is the property values for the next handful of years. And again, I base this off two things. Now, it used to be just Egger's schedule of construction. They're actually reality part of it now. So as Robin Team spoke of at the chamber event the other night, and we've got a substantial amount of investment already out there. So they will get a tax bill in July 1 for a pretty good swipe. Whether they're gonna adhere to their schedule thereafter, I don't know. I only have what's the projection from them. It could be better, it could be worse, but your 6-year values of this, and you look up at the far right-hand corner, is just under 340 million of investment. Part of that today, in reality, is probably around 250. So a big chunk of it's already done. It could be more. It could be more.
Well, how much is the percentage of incentives that we actually extend to these companies do we actually pay out?
Very small. Very
So what
small.
do we do with the difference of the money? Does it put any place? Do we project those expenses or?
I mean, we've typically taken it out of our economic development reserve when they've come due. And I haven't added to that reserve in quite some time, hence the reason why the previous slide with that red bar around it, I plan on putting some back in there for exactly Egger coming calling. Because they're gonna be a big one. But very few, because somebody either doesn't meet the investment or they don't meet the jobs. So, you know, we've talked about this when we talked about rewriting the incentive contracts. We just don't pay a lot of these out. But we still get the jobs sometimes, you know, some jobs. They may not meet them all, but we get some. And over the life of us running an economic development incentive program, I think we had this on some of the accomplishments thing or list of things we've done over the summer. We just don't pay a lot of them out, but still receive the benefit of it. So anyway, but Egger's gonna be a big one that in my head I gotta get ready for somehow. It's gonna be a big payment. What you're seeing here is the property values in the Carolina blue bars from left to right with Egger included. And again, remember the first couple of years is reality, and thereafter is their schedule. That's the best I got. I mean, they could be on a fast track to do more than 338, I don't know. The green bars.
Can I
Yes,
stop
sir.
you there for a second? You say paying Egger their money, but we're only giving them 50 cents back every dollar they give us, correct?
Right.
Okay.
Right,
Was
but
that 0027 or was that 0024?
it's 0027, yeah, right.
So we're only giving them 50 cents back of the dollar that
Right,
they gave us
right.
originally, so.
That's why the green bars, you teed that up nicely, are less than the Carolina blue bars. You see that? So without Egger, it's not gonna equal the Carolina blue bars because I have backed out of the values paying them. you can't build your projections on 100% with them included, or you're gonna get caught with, I owe them half back. So your green bars are always gonna be a little lower than the Carolina blue. What I want you to call your attention to is the gray. So see the budget, and I circled them in the first 2 years, a lot less than both bars, cause there's my down payment plan in full effect. But once that jail comes on, and once the full payments for the courthouse come on, 2022 and beyond, the gray bar is above the green. This is the slide to show everybody, the world, the EGRE money will be gone. So it's spent. It's spent on any which way you wanna look at it, whether it's the detention facility or running county government, however you wanna do it, it doesn't matter.
And that'll run up to 2029 like that, I take it, or I don't see
Their
anything.
incentive structure is a lot longer. You know, it was based on 770 jobs over 15 years, I think. But I can tell you this, and this, again, what I don't know is I haven't asked them. They've put a lot in the ground in a year and a half, a lot faster than they scheduled for. They scheduled for 125 and they're about 250 now. So whether that means they've built out phase 1 and they're moving into phase 2 already, I don't know. I can only project, you know, hey, they built this much and maybe the rest of it's just gonna adhere to their schedule, but that's what it would look like. So my point is if they get on a fast track and start getting into phase 2 and 3, these bars will move up. They won't go down. That's it for the EGRE piece. Calling for employees. Anybody need a break or anything? Or we zip on through? All right. I showed this to DSS board this summer, and I just thought the rest of you needed to see it. So calling for employees, because there was a big discussion at DSS board this summer about pay raises for employees. And so our chairman and Mr. Yates saw, I came down there and did a quick little slideshow for them to show them what kind of was going on. So start with some history. Cause I hear 1/5, 1/10 all the time. It's been 15 years since we did that. And so our revised personnel resolution, the old one quoted that, and there was some, discussions about, hey, why are we getting that, et cetera. If you remember when we changed pay, it was because 1/5, 1/10 was so expensive. And I show that right there in that little box. 1/5, 1/10 costs on average a year about $1.5 million. What we do now, just under $1 million. That makes a big difference when you're looking at those projections you saw earlier where all the money's spent. Or would you get the extra $500,000 over and over and over every year to do it? So that's why we got away from it. And the way we do the raises now, and I'm gonna show you in just a second, it's different than doing what I call a flat raise, which is what most people do, just straight percentage for everybody. It's across the board. But there you got a little history of what we have done, whether it was the global percentage by employee, the average, but what we did in the past, and we've done it here lately too, we moved the grades by the same percentage of the raise. Well, that really messes with the grades as they move this way, from minimum, mid to max. If you move it by the same percentage as the raise given, people ain't getting to the mid very quickly, and people coming in are also on top of them. So pay is always a trade-off. Remember that. You never have you move one needle on one thing, you affect something else. I'm not going to say that in the past we shouldn't have moved those grades 3 and 4 by the same percentage as a raise, because that could affect recruiting people. And it's like I told DSS yesterday in their meeting, you got two groups of employees. You got the folks that currently work here and the folks that I'm trying to recruit to work here. And pay can be moved to cater to either one. We've done a lot, as you can see, to recruit. I'm going to show you a strategy in a minute. I'm going to shift my attention a little bit more to the people that work here. But had you not moved those percentages, I say y'all, some of you weren't in these seats at that time, had you not done that, our recruitment efforts could be a lot more hindered at this point. At sometime in 2014, I think, or 2015, we changed the way we do 16, we changed the way we do this, and we started doing the dollar mixed with the percentage. And so, that's just a history of where we came from. What does that do to the pay grades?
Madam Chair, I'm gonna have to leave at 11:30. I've got an appointment. We were advised this was all gonna be over. Well,
I'm still on my fast track. I got 30 minutes.
I'll get back with you on the stuff.
Okay.
I appreciate it.
What does that do? What does doing the dollar and the percentage do to the pay grades? Well, I'll give you a little sample slice of 4 different pay grades. One on the lower end, somewhat lower end, kind of middle, and then where most of our directors reside. So you can see, John Q. employee comes in this, and people come in this organization and leave in a variety of different ways and a variety of different things that get paid. But a John Q employee coming in, just adhering to the pay plan, starting at a minimum and moving through the track, theoretically gets to a 30-year career gets to the midpoint at year 15. So our pay plan now, when you start mix matching that 500%, you can see this is pay grade 53, so this is one of our lower ends. If we only move the grades 1%, as opposed to the 1.5%, right now I'm basing off 1.7 because I want to move the pay raises up just slightly. That person gets to midpoint at year 9. And you can see at the back end, they clip out maximum pretty fast. That's very similar to 1/5, 1/10 right there. That's kind of how it works. So that shows that this person we'll look at in a minute gets a bigger jump percentage-wise on pay as opposed to somebody making a higher salary. Will that do the next pay grade up? You see it moves. So then you get another pay grade, which is, sorry I'm doing 2 of these at one time, 61 gets there at year 12 and clips out a little bit later. Keep going with your eyes. 69, which must be in the dead center of the pay plan, lands on 15. It clips out final 3 years. And then where a lot of our directors are sitting, I can't devise a plan where everybody gets to the midpoint at 15. When we do straight raises, everybody tracks through the pay plan at the same clip and intervals. The way we're doing it, every single pay grade has its own track. So it makes it a little bit more cumbersome to keep track of. I'm not saying that as if we should change anything today. I just want you to be cognizant of that. So directors hit it around year 18. We won't move the pay grades by the same percentage. That way people move through the track faster. They get to midpoint much quicker, and the people coming into the thing is not right on top of them anymore, or doesn't track as fast. The problem with that, again, everything you do has a con reaction, and I've told the departments this, and I'll only be able to do this anecdotally. I won't know. We have somewhat of a challenge recruiting for some positions in the county already, as you can imagine. Jail workers or EMS workers, EMTs, tough jobs. Social workers. Although yesterday, after talking to DSS, we've got fairly low vacancy rate down there now, so that's a good sign. But my point is, by lowering this, will we hurt recruitment is the question. I don't know. Everybody else have to keep their eyes peeled, and if they get a sense that we're causing a 0.5 percentage point, doesn't seem like a lot, but I don't know. I have no clue until we try. That's what the pay studies are for. When you do the pay studies, I equate it like a deck of cards. If we move the pay raises to 500 or 1.7%, which is built into those estimates you saw before, it's a slight move, but we're also in the middle of a pay study. The pay study, it's like a shotgun. Everybody starts at this basic premise as I'm displaying on this screen, because it's just math. But as they move through the pay and they get changes and they're here 30 years, it spreads out. You take the pay study to shuffle it back together. It's maintenance, is basically what it is. That's what it looks like in kind of practice. So somebody making 95 gets about a 2% raise. We're on the 21,000 scale, it's 4, and that's closer to your 53 grade range. It doesn't look like a straight raise where it'll go just like that. It's kind of like a teeter-totter. And I know employees probably know this, but I wanted people to see this just to be reminded. Look to your right. If I start that grade 69 and I start the salary, but I add on everything I have to add to bring that position into the organization, you can see the list of things there, whether it's covering their insurance, covering that retirement, covering workers' comp. It ends up being another $20,000 or 30% increase I have to do. I think sometimes that gets lost.
What page are you on there?
34. It's not just the salary, it's I gotta come up with the other 30% to get them in the system. I also circled right there, what you're seeing in that table to the left is growth in county insurance between what the county pays and what the employees pay. I hear that a lot as well. You give me a raise, but you went up on my insurance, you took it away from me. That has happened.
Mm-hmm.
But I want them to see, if you look in that circle, my growth is almost 5 times the amount of the employees. 14% versus 3 over the last 6 years. So I say mine, I say the county. The county's had to come up with 5 times the growth, and that is seemingly no end in sight. So as long as our wellness program, we do a good job. And we've talked about this in the insurance committee. Our wellness program is probably the mitigating factor to it not growing even more.
Mm-hmm.
So does the employees get anything, can they see this, that,
Our HR goes through, Kathy and them go through this stuff with them, I believe, every year when they have the benefits kickoff thing. The day I brought this down there to you all, though, I was just, some of the DSS board members had never seen this before, 'cause they don't obviously come to the employee benefit kickoff, so, I just thought y'all needed to see that. I'm not saying this, at this moment, I don't need to change anything. I'm just saying if I ever come to you all with a recommendation to, hey, we need to go back to straight raises, there might be a reason why. It's tougher to maintain the pay plan with all of these different tracks to get them through to year 15.
I absolutely love what you're doing because the payment plan has been broke. You look and employees be here for 30 years and they're nowhere near midpoint. And then we get into the problem where we become a training facility for Forsyth County and Guilford County because we put a lot of money in training employees and then they leave for a higher wage or they go somewhere else that maybe have more of a competitive pay plan. So I appreciate you looking at this. I mean, it's
two ways to do it. You can
it's
change
hard.
you can change how you move the things, or you can raise the pay raises.
Yeah.
Every year I go to the COG around the spring. I sit around the table with other managers and I hear what they're going to do for their pay raises. Last year it was about 3% for Forsyth. So as long as I hear 3 and my average is 3 again, you see how I get to 3. You get somebody get way more and somebody get like that, but the average is 3. As long as I keep hearing that, I'm okay.
Yeah.
I'm not hearing anybody going to 4 and 5 at the moment. Of course, while we're doing the 3, in addition to sometimes people are involved in the pay study where you remember if they were in the grade that got moved, they got 1.25%. So I think for now I'm okay.
Mm-hmm.
And we always do pay study examinations of folks individually within HR. If somebody's off, brings us a concern, we take a look at it. We try to comp them out with other jobs just like them in other counties. But it's a constant thing. It never stops. It's never.
and the reason we done the 501% or whatever it was to get the people on the bottom.
Get it up
off the
quick.
bottom.
Right.
You know?
And that's it's accomplishing its goal. It's pushing them to midpoint, as you can see, very rapidly. But by doing that, you just have to remain vigilant and conscious of the other folks sitting in the grades that now these people are accelerating and this one here is not moving quite as quick.
Yeah.
I tell you, pay compression, I do this with my hands. You got the pay grades going this way, 30 some of them, from 53 to 80 or whatever. And then you got them minimum, mid, max going this way. So it's like an accordion, you got this way. You can get pay compression going either way. And we meaning staff, we got to pay attention to all that. I applaud y'all for doing the pay study because that helps us shuffle that deck back in, try to get people adjusted to the market and get them in the right spot so we don't get behind.
That's a win.
Let me ask you a question, because it seems like we're still going in favor of the people who are making the big salaries. And you got and actually the 1.5% that we've been given in addition to the 5 is nothing but a cost of living pay raise. Do you really think that the cost of living has gone up any higher for a person making $70,000 than it has that poor guy down there making $30,000? I don't think so. And if you're going to do a cost of living adjustment raise, I think we need to do it fairly. And the one thing we don't do, and somebody pointed that out a while ago, is the fact that I had an employee come up to me when we first started this thing, and I'm not real happy. At that time, remember, we were doing 1% plus 500. I'm not real happy with that 1%. I said, really? And I said, if you do 1.5% on the 30,000, you make $450. I said, your 500 is already $50 more than that.
Mm-hmm.
And plus, you get a 1%, you get an $800 raise compared to a $450 raise. And that's closing that gap between the upper tier. We don't need to just be taking care of our upper tier people. We need to make sure we're bringing these lower tier people up to standards to where they're making a decent salary, can buy groceries, put roofs over their head, feed their kids, and send them and educate them. It's not all about the upper wage earners. We need to take care of those people, make sure we're comparable. But somehow or another, we've talked all this stuff about we love our employees, but we're kicking them out the door every day because we can't pay them anything. We're paying all the high salaries to the people that make the big money. If they need big money, we got means by which we can give them, raise their grade and give them more money. We want to make sure we keep these good people too. But I don't want to do it at the expense of our lower tier workers. The median income in this county is about $38,000.
Well, what you don't want to do then is go back to, this is the best you can do. This teeter-totter here, if that's what you want to do, That's the best way to do it, to affect lower wages. If you go back to straight raises,
What page is that, 33?
That's what y'all already put in
Yeah, that's
effect,
what I'm on.
if you go back to straight raises,
helping the
you're
lower
benefiting
people
me.
move up.
You're
Yeah.
helping me.
Yeah, and we got means to take care of you.
Right, but I'm saying,
You know.
what we're doing here, and I'm just telling you, until I worked here, I'd never done this before.
Mhm.
So what we're doing here, I'm not saying it's unique in any other county, I don't know. But we talked about it in Guilford County one time.
I went to Jim Tyson when Jim Tyson was HR when I first came on with this plan. Because it was unfair, and somebody said, a 1.5% across the board raise is the most fair raise. I said, it's bull. I said, biggest political raise you can get. It's rewarding all the people way up here on the cost of living and adjustment raise, which is all it
But
was.
that's not what we're doing. We're not doing straight raises.
No, I'm talking about before.
Oh,
That's how it got
yeah.
to this point
Yeah,
here.
right, and that's what I'm saying,
Yeah.
I'm not saying this stuff to say I'm recommending a change.
You're
I
just saying
just-
it
I
gets the
just want you
bottom
to
to the
be-
middle a lot quicker than people that's already
Oh, it's-
sitting here.
I want you to understand this basic concept, you've heard me say anything.
It's a double-edged sword, is
It
basically.
always has somebody that wins and
Somebody that
loses.
loses, yep.
I don't say anybody loses with this, but they will lose on the upper tier. We're gonna lose good people on the upper tier if we don't have things in
Right,
place
right,
to
right.
make sure we're
Right.
paying them comparatively
Right.
to other counties.
And that's what the pay studies.
So I think we can do
hopefully-
both and take care of our lower tier people.
That's what
too.
the pay studies hopefully help do, is pick up that market. You know, when you put a job class in the pay study, you pick one, 80, that you're asking PTRC, tell me what other people in that 80 in other counties, what they're doing, you know what I mean? And that's where I need the help. 'Cause we don't have the staff here to do it over and over and over and over and over. You really need to do that every 3 or 4 years, or less than that, every 2 or 3 years.
And I like what you were leading to a while ago, when you were talking, because we don't need we need to recruit good people. We need to have good pay and benefits to do that. But we don't need good people coming in, starting the job, sitting beside of another great person who's been here 10 years, making the same salary they're making.
And that's why I'm saying, I'll be on the lookout for a budget that's gonna do two things. Creep the pay raise up a couple tenths of a point, but slow down the growth of pushing the grades.
Yeah.
Just barely. Now, again, I say, we'll watch it as we see recruitment. If recruitment becomes devastating after that move, our only logical conclusion is we moved at that 0.5% and that caused a problem. I don't know. So we'll just have to see. I mean,
You know, recruitment ain't based on salary, 100%. If you remember our DSS, when we was looking for a new director, we found, an applicant that lived outside a big, metropolitan area, that everybody was chasing salary. That's all they was doing, so their recruitment process was no better, because they was just moving here temporarily. Was you in on that meeting? Would you? Yeah, so.
and that's one, this is so macro. You're talking about for 900 and something.
Right,
You know.
but I'm just saying, that ain't necessarily, and I don't know that we lose a lot of employees
And I don't know
to-
either.
yeah,
That's why I'm willing to try it and
Right.
see, because what it's gonna do, it's gonna force the movement from minimum to mid. For the folks sitting in the grades, they're gonna push faster. The pendulum's gonna swing, instead of the folks coming in moving quick, now they're gonna slow down. Everybody sitting in the grades is gonna pick up speed. And I can't really fix, folks that have been here 22 years and didn't get to mid just yet. Now, some of those moves are because they were sitting in jobs that got reclassed along the way. Once it get reclassed, it kind of starts all over. But not every case. So we've got some that just didn't clip off. I can't fix the backwardsness of it, but going forward, I think I can make it a little bit better. And just
This is a
kinda-
lot of work for you guys. I can
Oh,
see
yeah.
y'all dug
Absolutely.
into it deep, so.
I have to give kudos to the board.
The
you know.
conversation down there with
Sorry,
the
the
DSS
DSS.
employees got me thinking about it. And just like insurance, I went back and checked my math. And, and in life, you learn something every day. And I said, you know what, everybody, they got a point.
They do.
They got a point. So how do we fix this? And again, you also say to yourself, I'm paying $1 million a year for pay raises. I really can't afford anymore. How can I do this with the money I got? And that's kind of how I started to think about it. Let's change the game here just a little bit. But all the while, not trying to hinder pay raises from growing. I don't want to get too greedy and do a massive overhaul increase in that while we're doing a pay study. That seems to be a lot. But anyway, this is kind of the best move I can come up with. I thought y'all need to see it, so you just kind of be informed in your head.
Who done all the work on this, you or?
I guess, these gentlemen helped me here, and they come into this kind of It's the ninth inning appropriate, I mean, the ninth inning.
Pinch hitter, huh?
Yeah.
And that
When I've
takes some
said all
numbers.
these years, you know, Jane and a lot of folks in this room, no offense, the gray hair syndrome, they all have to do the same things I'm doing in my office, which is teach everybody how to do this stuff. And so, hopefully the future, we'll have a lot of people in a lot of departments. We've been impressing that upon folks in the leadership programs and just kind of dealings with their data. Get some of that knowledge out of your head, and it's tough, because I start this thing every year around Thanksgiving, and here I am sitting to you in March. I say start it, and I leave it alone, I tinker with it, I change things, but I change my mind. I gotta think through what I wanna show, and it's hard, and they have the same type of job. They do something, you know, all these directors sitting here have ways of doing business in their department that they gotta realize they know how to do it, but are they showing somebody else how to do it, you know what I mean? And that, as you all can imagine, owning your own businesses, that is hard to do, because you come across that knowledge from just years of doing it. And you learn through trial and error, hard way. You know, you failed some, you won some, so it's just hard to do. But that gets us to the projects. We're almost getting to the close here. That capital plan, 5 years, that's an overall look at it. I circle the parts that are of any consequence. It's driving that orange bars that we just saw earlier. And the big one is the jail, and I'm gonna get to it in just a second. But I want you to pay attention to the bottom part there. The cash, and these sources of funds here, you've got what I call capital reserve. That's just a fancy word for cash. The cash coming from the county. You got enterprise funds, which is Charlie. He's got his own set of money he'll have to learn to live with to buy equipment and replace sales. You've got
36.
Other funds, which we'll talk about that in a minute. That's the state funds coming to the airport for their two big projects, so that's money in, money out. The county's not gonna be participating in those lights or the runway. And then you've got debt financing, which is going to be the jail in just a second. But I circle that 19 because globally, that's the cash it's gonna take to run the projects that are in that plan that I'm about to show you. And I only got, as you can see, 5.3 in the fund. So you remember when we said we're gonna take down payment money and move it into this area? That's what I mean by that. We've got to cover a gap, basically. Our plan isn't what you refer to as fully funded. It used to be, but with the jail creeping into this thing, it's moved.
150,000 a year or something.
Flip to the next slide real quick, and I'm gonna break that inside that red square you just saw. Here's what that breakdown of that is, because this is what is of interest to you. Your what I call county projects. And so the jail's first on the list. And that number there may or may not be familiar. For now, we're working off what we got shown the other day on the Mosley estimate. I'm not so much interested at this point in the plan. I'm interested in the dollar amount, because I'm trying to get to a, you know, you had said this the other day, we'll get to a number, we can get some good bids or shave it off, but I'm, at this point, for planning purposes, I'm interested in the top end number. I'm trying to set a ceiling, not a floor.
You're shooting at 53 million right now.
Right, and that's the Mosley number, you know, and that's up from the Bill Bergen number for, you know, we worked off of forever, which was 41.
But you know, something that, and Chris don't know this, and Karen does, and Steve does, because they sit on the committee. Out of this 5.3 million a year, 4.5 million is staff.
Huh?
Or 4 million is staff, or the 5 million it takes to run it a year, or whatever. It takes $4.5 million a year to run it,
That's
not.
right. We'll get to that in just a
not
minute.
the
All
actual-
this is the debt service to build the building. This is not running it yet, so we ain't gotten to that point yet. But look down that other list of projects there. So we got backup 911 center, and we talked about that at the facilities committee a couple times, where we're gonna have to get some consoles, some mirror image consoles of these 7500s we got over in the prime site, and another recorder over there in Thomasville once we get the building prepped, ready to go. So there's the cost for doing that. There'll be some 911 reimbursement, but it won't be but about half. So we'll have to cover, the county will have to go do the gap, essentially. But it's in the plan. Got a server, all of our prime servers run 90% of this place are approaching 10 years old. They have got to be replaced. The dollar amount's so big, I'm trying to do it over 2 years, as you can see. So that's in there. We'll talk about that in just a second. I put some money in for now, just a planning number for a permit system. Jason's joined in on a couple of these. Him and Inspections Department, and I think Guy, some of the other ones, and Lillian's crew, Environmental Health, have taken a couple of demos of some, we got one that got a real good cost, but one of these days we'll get it before you all, try to talk through what do we wanna do. I put a plug number in for now. So at some point in time, we gotta get off that, Xerox system down there that we use down the sidewalk. The window replacements, and some of you may have, we got window replacements at Colonial Drive and Cecil School. Remember when we did the Cecil School roof, we talked about this. We said, hey, next issue is gonna be windows, and the next one after that's gonna be piping. So, we put in quotes. These are based on quotes for both of those facilities. Can't do them both at the same time. We just kinda have to do one right after the other. Now, I still got the EMS bases sitting in there from the EMS study from now it feels like eons ago. But we've pushed them back, and part of that is, we've made the provisions with the emergency light up here and felt like we could get away with it for a little bit longer with the Lexington site. But for now, they've moved back. The grant money for the airport runway, the lights, the capital plan I gave y'all in January was a little bit, I need to update. The lighting stuff is almost done. We've received almost $5 million from the state for that. I forgot all about it, but it's been approved and we received the money. They're going to be substantially complete with that part probably by this summer. We're moving on now to the taxiing of the runway, and a couple agendas ago, you guys had starting to approve state money for the design of that. So I anticipate very shortly there'll be a big old request for them to give us money to start on the runway part, strengthening. And you remember the premise behind that: get it strengthened so bigger planes can come in and handle more commerce type stuff and get the economic development stuff up. That's a snapshot of the red box in the global part. So you can see the cash it takes to run this thing, $14 million. And remember, we got 5 in the bank. So we've got a little bit of a hole there, and that down payment stuff I referred to earlier is going to be what's driving to fill that hole. Most of that being cash I'm planning on putting, obviously, on the jail. Let me break these projects right down in that little red box right there. So the jail's first up. A lot of words here. Y'all know all about this in the committee that went and toured Iredell County the other day. Iredell County, I thought, and y'all pipe in, I thought it was a good comparison to us in terms of their old jail looked a lot like ours, and Sheriff's gone. I think he kind of thought the same thing. We were all very impressed with the new facility. And it's gonna, there's some things I guess we all learned as part of that. So what we've got in there now is the planning number from the Mosley to get us to that 550-ish bed capacity. Remember, you're dropping some beds and adding some new ones, so we're doing the net result. That 4.4 Mr. Yates spoke of, I'm not gonna go through the math. I can tell you in just kind of plain English, but there it is. That little bit of language there under that operating impacts is my attempt to put every bit of the math I did to derive this. But basically what I did is I took the jail budget that we have now, the county money that goes in the jail budget, and it's about $4.5 million. Divided it by 297 beds, gives you some dollar amount, and then extrapolate that out for the net new beds. So that gives you to a total dollar amount, as Mr. Yates pointed out, it's about 4.5, I'm just rounding. Because you're basically doubling the staff. And then within that number, I went back to their budget again and said, you know what, how much of their whole budget percentage-wise is staff? And it's about 80%, I can just tell you. And then just took 80 of $4.5 million and said, divided that by the average cost of a frontline detention officer, it ends up being a need for 49 more staff, might as well say 50. Because you're basically doubling the beds. There's 45 people in that division, you're basically going to end up trying to double it. That's as good a planning number as I got anywhere today. And we're going to get better numbers as we engage somebody to help us figure that out. But I thought that was a good way to kind of get my head around it. And then you're going to get more medical, more food, the whole 9 yards.
So it ain't building the jail. Building the jail is a small cost,
It's operating it every year. Right. Right. There's the runway strengthening again. That's money in, money out. State paying for it. There is your countywide servers. At some point in time, be on the lookout for that 342. We're going to have to get you all something and get it on the agenda to go ahead and make a project out of this and start the first of 2 years to get this done. There's the backup 911 center. That'll also be before, probably start with the facilities and get it onto the board at some point in time. Facilities has heard it once before, but we are working with 911 board to try to get resolved kind of what are they willing to give us on buying these consoles. We think around half-ish. Because we need to get the quote-unquote, as I said, the mirror image, which is consoles. Permitting system, again, there's the plug number, there's the Cecil School windows, and then got to get this thing to the end here, get Jerry up here for the revow. So when you take every bit of this stuff, if you go to slide 41, if you take all of this stuff from the whole morning, all of the projections, all of the stuff with staff, all the stuff with the schools, insurance, everything we talked about, and you shake it out over the next 5 years, you got two ways of looking at it, scenario 1 and 2 here. What does that do? Two questions come up every year. What is it gonna do to our fund balance that we're sitting on now? And you know, we're sitting on the, let's just say 45%, which, by the way, we gotta hold 18 for state law. I mean 8 for state law, 18's our own internal policy. What does it do to our fund balance if we try to clear those debt bar roller coasters, the peak that we saw earlier? If we tried to go at it alone, is what I'm trying to say, with no tax rate change, what does it do, and can we get by with it and fund again? And the $4.5 million's programmed in, those operating impacts that Mr. Yates just spoke of, the debt for the facilities in here at the $53 million. Remember I spoke of your debt service budget's got to get from 16 to 18. That's building that in to try to get through all this stuff. Pay raises at kind of the way they're looking at now, growth in insurance, all that stuff. If you program it in, what is it going to do to us, basically? And that's kind of my guess, you know, at this point. If we try to go at it alone, it's just scenario 1. We're going to eat into some fund balance doing that, trying to clear that gap. It could be as much as 10 points. I'm not exactly sure. Based on these numbers, that's where we would head. Or do we look at the increase in the tax rate somewhere around the 2.75-ish range? If you're trying to live like you live today, you see I circled those in 2 boxes if you look at scenario 2. Where we're sitting today is to the left, and then if you look far to the right, you can see the change in fund balance above there is a hash, meaning you didn't eat any, you didn't give any up. The percentage ain't exactly the same, but you see my point. If you're trying to stay where you are, so you have money to continue to do other things other than just build jails, that's what somewhere in that 2.75 to 3 cent range is what it's going to take. If we go at it alone, we could go into some fund balance decline. Look up in the left-hand top up there. Here's what I don't know, the economy. We've talked about that before over and over and over. I don't know what's going to happen over the next 5 years. I can take a guess, but I don't exactly know. State funding. If the state makes decreases in funding for things that we probably somewhat will end up having to do, I can't account for that in the future. It's tough. And then I don't exactly know is $53.5 million going to be the number. You know, it's better than 41 planning for, obviously, so we took it up for the right reason. At the bottom, it does include, like I said, all of the stuff from the base budget. As you know now, it's got the net EGR effect. So EGR is cooked into these numbers, and we're going to talk about this in just a second. It's got a net neutral reval programmed into this. In other words, the values are high now, and you know the basic premise behind this. Values are high, you can take the tax rate down, generate the same amount of money. Other way around when the times are bad. Right now, they're high. So we're going to talk about in just a second, do we want to move the reval up from 8 years to 6 to try to be on the upside of this thing before it goes down? But when it goes down, there's a mathematical formula to figure out whether or not you're holding it at revenue neutral. Do you just stay at 54? That's what this is planned for. You just leave it there.
Let me ask you a question, Casey. $4 million in 2024, $4.2 million that we'll be digging into the fund balance. 2025, $4 million. Mm-hmm. What happens in 26, 27, 28?
Well, I don't exactly know, other than you see how it's going down.
Yeah.
We'll get over the hump, and then you remember the debt bars. You're going to get some relief. So if you could make it to that point, in theory, you would be fine.
Mm-hmm.
But I hate to say it, you're rolling the dice.
But I just wondered where it went. How fast did it go down? 300,000 a year?
I don't exactly know because I didn't keep going with it. But you're hitting that point to where the debt services. My hunch is the debt service is going to fall off so drastically in 26 and 7, that if you could make it to that point in time at 39% fund balance, you're probably in the clear. You're not going to hit your 18 if that makes sense.
Right. But 38% fund balance is quite a bit.
It's good, but remember this, and after years of doing this, trust me, I'm preaching from experience. It's a lot easier. It's hard to get it up. It's spinning. It's very fast. And once you get it down, you can't. It's hard to get it back. It's pain to get it back up the hill. So like I'm not saying 45 is where we need to be either. I'm saying you're talking over decades to get it. This didn't happen yesterday, and it's for all the good reasons. We've done it, so we actually have a two-pronged plan to possibly get over the hump. But your assertion from the beginning was correct. Building the facility is gonna be one thing, running it's gonna be a whole nother conversation, so. On the next slide, it's just a breakdown of that scenario too. A lot more numbers than you probably care to see, but I can do this real quick. Again, the right-hand side assumes the pay raises for employees, 2 points on the schools, the steady property values plus the EGR, and steady growth on the sales tax. That steady growth on the sales tax is not gonna remain 10%. I'm gonna tell you right now, it's not. It's gonna come down. And the model has accounted for that. I brought it down at times. If it stayed this way, great. I mean, you have even more money to deal with. You can see there what the tax rate calling from the model would generate in terms of money. The green part up there at the top is that $4.5 million Mr. Yates just spoke of, plus theoretically the operating impacts for staff and an ambulance on the capital plan version of adding the EMS base. Whether we do that or not, I don't know, but it's still in the plan. So that I highlight that green for a reason, because that's the part you're trying to get over on right there, and it costs $4.9 million. So the model and the tax rate increase are almost the same amount. Just real quick, because I think again, Mr. McClure's asked me this a couple times, and maybe I can go over this slide with him one of these days. If you take where we actually finished spending in the general fund, I'm not using budgets now, I'm using actuals, reality. You come up to revenues over expenditures to a dollar amount, as you can see. You end up having a surplus. If you take out the growth, and I'm talking what you set the budget at versus what it came in on the two sources, property tax and sales tax. If you back those out, see how they're negative numbers? And you account for moving money last year, as we spoke of before, from the general fund to capital reserve to get ready for all of the things that are needed in the capital plan. Your general fund budget almost lands dead even. It's actually just barely in the hole, $300,000. We did this slide last year and it was $500,000. So we're but my point is I have $145 million, and this is reality, so this ain't the budget. This is dead on. If you just take two pieces of the puzzle out, so this ain't an expense deal, and we get in these conversations when we talk about PBB a lot, but this ain't an expense deal, this is a revenue deal. So yes, right now we have over collections. It won't always stay that way, and right now they're spoken for. So reval. Jerry, I might need your help for this one, I don't know. There's a lot of information in this reval, but I just touched on it. I'm actually gonna skip through some of these because I think I can land right on 12. You guys, I think, are pretty savvy and know what the reval process encompasses. 45 and 46 goes through that process. We do an 8-year cycle. By law, you gotta do it every 8 years. DOR has always wanted people to do it at 4. That's almost impossible for us because of the time and the staff. Now, jury staff does a good job of, during the years that they're not on a reval cycle, of continuing to pick up property, you know, continuing to update the scrolls. So we kind of keep going with this notion all along, all through the year. But I won't go through the different approaches. You know, you got the cost approach, the sales approach, et cetera, on slide 45, and you got the process for when you start to do whatever year you pick, how you notify citizens. You've got an appeal process, you know, informal review, et cetera. If you look at 47, you can look at and see our sales ratios from what they were the last time we did the reval versus now. They're going down, and down means your values are going up. So it's not as much percentage points down than it was in the last time we did the reval. And the spread, that coefficient of dispersion is just a fancy way of saying the variability in pricing out here is getting wider and wider and wider. So it's getting less reliable. That's the reason we do a reval, to shuffle. It's like deck of cards again. I can't believe I keep using that as an analogy, but you shuffle the deck of cards back together to put it all back together. The appeals, if we were to do a reval now, you had about 4,000 last time. We're going to estimate it with double. You're going to get, if we move this to 6, you're going to get some calls, or we're going to get some challenges. You all get calls, we'll get some challenges at the tax department. What does that look like? The reason, again, for doing this, you may say, what are we doing it for? Well, again, the values are high. And so, as part of the government's duty to kind of figure out what the new values are gonna be, we're gonna have to do it again anyway in 8 years. If we do it now, we have the likelihood of timing it where maybe the rate can stay even, and we have the benefit of picking up some of the extra revenue. Some of the extra revenue that will go toward that 4.5 million we just spoke of. This 48 slide shows you just a mathematical equation the state gives me that says, Casey, this is how you figure out your revenue neutral rate. A lot of numbers on this thing, but you basically take all the values you've done since the last time you did a reval. And you take the values, and again, these are estimates because 21 and 22 has not got here yet. But based on the values that I keep seeing, we're gonna keep moving them up. 15 billion with Edgar cooked in, and you can see to generate $80 million worth of revenue, again, in that green box, it goes down. You have higher value, you don't need the tax rate to generate $80.1 million. But then the state allows you to do what they call a growth factor, which for us is 1.6%. Remember I spoke earlier, we grow about 1.5% every year. Well, that's what I meant by that. We had a little bit better last year or two, and that's why the percentages creeped up. They allow you to take that tax rate and apply that growth to that as if you weren't going to do a reval. So for us, it ends up being 54 and just under a quarter. That's why I said before, the modeling of what I try to show you now is just hold it flat at 54. And it generates somewhere in the neighborhood of $80 million. But the question on the table is, we got a couple things here. We are timing the economy. The tax department's gonna need probably a little bit more resources, not another position, I don't think. I think we might need a little OT here and there, et cetera. The question for the board is, are we game for, or we have any appetite to move it to 6 years? If so, we gotta get that process started fairly quick, because the stuff that would go out to citizens would be, Jerry, correct me if I'm wrong, January of next year? So they're gonna need a little lead time and get going. There's another issue there of, Jerry got a quote for doing some aerial imaging, which will help us get the stuff a little more accurate, as you can imagine, data. The cost of that's about $159,000. So there's some money in the reval fund that's separate, that used to sit there, it's about half of that. Is there an appetite to do these things, get the aerial imaging, move it to 6 years, or do we want to stay at 8 years and let the dice roll and see where the values land? I just put you a little stat there too. 22 out of 100 that I could find have less than an 8-year reval cycle. Again, DOR pushes pretty hard. They want everybody off 8. But a lot of small counties just can't do it. They just don't have the staff, and they don't have the expertise and the ability, the technology to do it, so.
What does it cost to administer this, reval?
Like I said, Jerry will be able to do it with the staff, the appraiser staff he has, the budget he has. There might be a little more OT every once in a while to get that done, but because we've been keeping the scrolls updated so hard during the off years, we don't have as much, it ain't mass bulk work all at one time. You know what I mean? We don't wait around to do this, but there'll need to be I think Danielle will probably have to make a resolution. There'll have to be a formal action by this board to move it to 6 years. But I bring it to your attention because if we're going to do it, we need to get that in front of you all sooner rather than later, and make that official and start the process. Because Jerry's got timelines and things he's got to do.
Jerry, has there been any estimates as property increased or decreased?
And I think that's something definitely the full board would wanna discuss and see,
I do.
instead of so many people being out.
The rest of us.
Madam Chair and Commissioners, the question was, has there been an increase? That's a hard question to say. It's not an exact number. Some have increased more than others, but I'd say it's an average, probably 20% since the last reval. Our ratio is down about 10%, so some are as high as 20, some around 10. But, across the board, I would say, to be a safe figure, 10%.
Increase?
Since the last reval.
That's good.
Yeah, sir.
Because that's gotta be considered where you decide you want to have it.
Mhm.
Yeah.
I mean, if the resolution piece, I need to get time to get it drafted. And again, it's a process, so we would just be getting started. You know, nothing happens to me. Also, I have to, next year's budget, I have to, by law, post it.
Mhm.
You know, what that rate's gonna be for everybody to see, so, if, with you all's permission, we'll bring you forward something. If you wanna move it to 6, I mean, there's obvious reason why. But it will come along. I'm confident with more appeals. There'll be some more challenges because, you know, that's just how the process is.
How long a process will this take?
Jerry, I need help again. If they approve this sometime this spring, I guess you all get started immediately. And then, but you're headed toward next January notifying folks, right?
It's caused some, anxiety down there to be under pressure to do it by January, but I have a lot of faith in the staff, they can do it, with a little bit of overtime, and, they can get that done by January.
But you're backing up into, your backstop date is January of next year where you start notifying citizens, right?
Yeah, we're gonna send out notices at least by February.
So they've got to get and that may be where the aerial imaging is the benefit. Get some of that data, get everything updated to the point to where you can notify citizens basically next January. So your clock's ticking now. You've got 10 months to get all this done and get it to them.
Definitely need that imaging.
Okay.
With the commissioners that are not here, you know, we've got to have some time to think. Perhaps put it on the agenda.
They've already promised we won't make no decisions today.
No.
It wasn't decision today. I mean,
No.
she's
So,
right.
perhaps just, by, do we need a month? Can we make a decision in 2 weeks? I don't know.
I mean, if we craft the resolution and we have it, say, on the second meeting in March as a deliberation item,
Mhm.
so, I mean, it's not a consent item. Cause do you have to call for some type of public hearing to do this, or is it just kind of a change, adopt a resolution? So, maybe we can just have it ready for that second meeting. That'll give you some time to contemplate stuff. If you got any concerns, let me know, or Jerry, and we'll work them through. But we'll head to that date, and I think that'll give you enough time.
In the meantime, we're going, we'll start to, pricing now. We'll go ahead and,
Okay.
wouldn't that help stabilize that rate of 54 cents? You think?
Depends on how much it ends up going up. I don't know, and it's too early to tell. That's the hope, anyway. But we'll head to that point, if that's okay. That's all.
What you said it would generate?
275, it's gonna be about $4 million. Close.
Mm-hmm.
So the theory would be, if Jerry's reval picks some of that up, preferably all of it. That's the question on the table, and it's too early to answer that, and I don't wanna give any false hope that I can.
Yeah.
But if you pick it up through the reval, maybe you can make it through. That's the question.
And that number's just off of past revals, or is where you're getting that number? Because like I said, if you're doing a better job now keeping, your property values updated, then there's not gonna be a bigger swing in what that number maybe was in the past.
Right.
How are y'all knowing that, seeing the projections of what you might generate?
Business sales ratio, I think we're getting down close to 90%, so that's why I said 10%, we might could do, which would be what, $7 million?
Yeah. That's all I have. I got y'all through that fairly. I almost made 12. I got 12:05, so.
I tell you, probably what I'd like to hear a little bit more is maybe have, Jerry to come back during the informational meeting.
Yeah, I agree.
When the rest of the board's here, and maybe explain to us and what your projections are and how you think you can get there.
Okay.
Don't have to be long, a 15-minute
Are you gonna start with A, Jerry? A, you're not gonna start it with S, are you?
So that's gonna move it till the first,
So the April second
April
meeting
2nd
instead
meeting.
of the April.
Well,
instead
so
of
then I
March
guess that, I mean, I gotta always go back to jury on this one. If you come before the board to do some information at the April information meeting, and then we get a resolution crafted to put on an agenda, a subsequent agenda thereafter,
That would be April 14th.
now you're pushing in the middle of April before you can get started. Is that, how bad of a timeline crunch is it for that for you?
It's pretty bad, but like I said,
That's a good point.
start today, writing and stuff.
Well, why can't,
We have a special, what's a rebound model, we can go ahead and start pricing and get ready for it. And if you say go, we'll have that much done already.
In other words, get the behind the scenes process ready.
What about the possibility of, instead of Jerry doing that on the April 2nd meeting, that he come in with the information on the March 10th meeting, which would give you all information to be able to build off for the March 24th meeting, which would sort of keep us on the same timeline.
I'm good with that.
that would keep.
Basically, Drew, can you go next Tuesday night to give everybody an update on the numbers?
Okay, option number
I ain't trying to put you on the
three.
spot or anything, but can you do it? Can you tap dance in 3 or 4 days?
What you doing tomorrow for lunch?
Okay, I think we finally made
That's
a
it.
decision there. Okay, do I have a motion
adjourned.
to adjourn?
Second.
All in favor, say aye.
Good job, Casey.